Alright. Oh, wait, I could change Stefano's clothes, dude! Oh, hold on a second.
That's okay.
Stefano's got a
trying.
tail.
Yeah, we're planning to go back regularly to get lemons, so
Oh, look.
maybe some next time.
Alright, excellent.
Some cornbread there,
Ciao.
Wally?
More than just cornbread.
How are you doing? Haven't seen you in a bit.
See, it's been a little bit. I am good. I've been good.
I'm just gonna
Oh,
let
sorry,
this
Sinara.
man rest it off behind here, if that's alright.
See, of course.
Okay.
What happened to him? I'm assuming you got a little ratty.
He got very ratty. Hey, Wiley.
How you
Howdy,
doing?
Kiwi.
Wait. Hutch. Are you
Yeah.
okay?
I'm alright. Been better.
Okay.
If you wanted to go over,
You and me talk after
work with
this,
Marco
okay?
on that chat.
I can do that. Margot, you need any help with anything?
I'll be on the porch. I need to
No,
see.
it's just a checkup.
Okay.
Pardon?
Alright, let's have a look at you then, shall we? Where would you like to start? The chest or shoulder?
Well, let me wriggle this goddamn thing.
Like a hand? Alright, okay.
Yeah, no, I've gotten pretty good at taking the shirt off one-handed, you know?
Yes.
So, the chest ones, they said they weren't that bad.
Holy
Said
shit,
about
dude.
he didn't
That's
really
just
have that much
built.
powder in his bullets, but still hurt like hell. The shoulder's the worst.
Alright.
Buried a hatchet right into it. Just,
Ooh.
Alright, I'm sorry. You need
No,
something for
you're
the pain?
right.
That much pain from just unwrapping the bandage, huh?
Considering I just got shot 6 times yesterday in the chest and had a hatchet buried in my shoulder, yeah, it's a little painful today.
Would you like some grapeseed?
Yeah, do you want something for the pain if you're not taking anything for the pain at all?
He must be new around here, Margot.
Yes, we know you don't like pain medication, but would you like some?
I'll
On
take
the
grape.
contrary.
I'll
I'm very
take
old,
grapeseed.
actually.
You'd like the grapeseed, right?
Yeah, we'll do grapeseed this time.
Okay, I can grab you some.
Oh, thank you.
Okay. Let's get this all mess into you. Help out with the pain a little bit, huh?
Yeah, we can do that. I just don't like taking painkillers if I can avoid it, but it's hurting pretty bad today, and I got a funeral for a dear friend of mine here soon, so need to kind of be at what best I can get.
Alright, let's try and get you as ship shape as we can, eh?
Yeah.
Alright, here we go. That should start helping you fairly quickly, okay? Give it a moment and it'll start to kick in.
Yeah, thank you.
Alright, I'm going to very gently just apply a bit of fresh salve on these, just to
May 2nd?
see if we can bring that redness down a little bit.
It was
Yeah,
after I
go
got back
for
from
it.
vacation. Oh!
Yeah, the
Dude, did
feeling
Hutch...
warm. I take it that's probably just the healing.
Hopefully it's not a sign of an infection, but we can
Yeah,
always give
well.
you some feverfew tea or something to take just to try and combat that, just in case.
Okay. You know how Valentine is. It gets a little messy with the schmud.
Indeed.
was just feeling good enough that I was gonna have you examine the forearm again, see if I was gonna be fit to go back to duty.
I have
And
no
they got you in
idea.
the same shoulder, right?
Yeah, left shoulder. Thankfully, I don't feel any reduction of power this time around, so he must have missed anything major outside of that artery. But
You want to go back onto duty already?
that's the thing about me. I always want to go back on duty.
Of course, but I mean, if that bandage taking off in and of itself caused you that much pain, I'm not sure going back on duty is the best call. I mean, I'm just a trainee, but you know.
Hutch, sorry to tell you, but I'm not going back on duty until you healed up. Okay.
I know I'm not going back on duty. I'm talking about yesterday before the asshole got a hold of
Okay.
me.
All right.
See, that makes a lot more sense.
That was the plan. I was gonna have the doctors look at my arm yesterday before he got a hold of me, and that plan is now set back a while.
Let me take a look. I trust it is.
Well, hopefully you can still do the hand strength exercises. Just have a look at the shoulder and just make sure there's nothing untoward as opposed to, you know, a cut.
Yeah, no, they put some extra bandaging and stitching on it. Said something about a complete sever of one of my arteries, not just a nick. So they had to do a lot of work on it. To be
Well, it's still
honest,
here, so they obviously repaired it.
Yeah, can you just put a space
still feel
after
weak as
Amendo
hell, but
between
that's
the
probably
pipe
just the blood
and the
loss.
last name?
They said I lost a lot yesterday.
Well, a severing of an artery will cause blood loss, I'm afraid.
That
Just a
is,
little
yeah, these usually go hand in hand.
Yeah, usually they do, right?
Were you given a blood transfusion, do you know?
No blood transfusion. There was no donors available.
All right.
They just had me rest and take it very easy yesterday. Same for
Okay.
today, so I'm not allowed to ride. Got no use of the left arm. Obviously, they decided to sling it up a bit.
Stefano, can you get some Feverfew tea and some phenacetin? Put them in an envelope for him.
Yeah, of course.
Thank you. I'm afraid I haven't got any honey on me today, but if you can find some honey, I would advise mixing it with the Feverfew tea. It's just sweetens the taste. That does wonders.
Was it penicillin? Or Phenacetamol. Oh. Goodbye, Bella. Alright.
Oh,
So I don't. It feels a little sore. I imagine that's just from the needle.
Here you go.
Thank you, trainee.
around here?
Yeah, it's right on the right side of my neck.
All right. I imagine it's just bruising, especially if you did it with some force.
Yeah, we gotta.
I mean, if he was only removing
around
blood
with
and
his
not putting
clothes.
anything in your system, then I'm less worried.
Definitely gotta fuck around with his clothes.
I imagine if he put something in my blood, it would have already taken hold. But he said he was
Well,
taking
indeed.
it for something. My guess is taking back the blood that was spilled from his friend that day we fought.
I'm actually like a really big fan of Stefano's outfit. I might just make a few small changes to it. A few touch-ups, you know what I mean? Just a few touch-ups to him.
Let's give this area a little bit of a clean.
Okay.
It's definitely a bit red, a little bit tender. Luckily, the feverfew and phenacetamol he's just given you will, well, it's to combat any sign of infection you saw in your wounds on the chest. So let's see if that can also fight that and
Okay.
monitor it. Keep a close eye, all right?
Yeah. I know that you all use needles that you guys prepare and clean up, but what if it wasn't a cleaned up needle? What should I look for?
I'd say probably all the same things as normal infection. You know, itchiness, redness, swelling, pus,
Okay.
discomfort.
Yeah, I mean, perhaps slightly foul-smelling discharge from the area. You know.
Also the usual. At the end of the day, what the dirty needle does is it increases risk of infection, right? So
Yeah, that's what I was worried about.
it's like you know, leaving wound open and getting wound dirty, increase risk of infection. Doesn't necessarily mean you will get an infection, but why take the chance?
Yeah, exactly, right?
Mm-hmm. So the stages right now, I mean, the redness implying there might be some setting in. We can use some medicine to combat that. We will just monitor that and see how it goes. If it becomes something worse, we can look at you know, cutting and draining and things like that.
Okay.
For now, I'm not overly concerned. I believe it's if it is an infection, the onset stages. The medicine we've given you will hopefully kill it off before it becomes anything more concern.
Just say,
Here's hoping, right?
Well, indeed, and if it does become more concern, we'll do it then. Don't worry, it's still things we can treat.
Yeah.
Let's just get it a bit of gauze and a bandage on as well, just to make sure nothing else can get in that area. I mean, it's not going to get through a needle mark, but just in case.
Yeah.
All right, anything else I can do for you, Hutch?
Oh, I think that'll do it. Feels like I still have some good flex behind my hands. That's a good thing.
Oh, good. Yeah, albeit I, read the report and see that it was the arterial damage and things. Doesn't appear, but there was much of a muscle or any other, nerve or anything damage happening there. So it shouldn't affect the hand really at all. Just wait for the wound to heal up. It looks pretty clean and well tended so far. So make sure you keep it that way, and you should be right as rain in no time.
All right. Yeah. All right, doctors. Well, I appreciate it as always.
Of course. Lollipop,
What flavors you got today?
apple, pear, cherry, peach, and beetroot.
Fuck it. Let's go with an apple one this time. That just sounds good.
apples are good, you know. An apple a day keep the doctor away.
Exactly, Stefano.
Yeah, well, an apple a day keeps anybody away if you throw it hard enough.
That's a good point.
But hey, it all works the same, right?
It needs more.
Exactly.
Oh, you know what's the roach dust that's making it fucking dirty? I say it needs to be more vibrant.
Oh,
Fucking
God.
road.
All right. Well, doctors, I appreciate it very, very much.
Of course. You know where we are if you need us, and just check in if anything changes or you have any concerns, all right?
Yep. And by the way, this trainee, I like him.
I'm glad you like it. I'm somewhat trainee, somewhat not. You know, very old doctor, been around a long time. You know.
And we'll hope you're around more.
I do my best.
Well, it sounds like you have a bit of a sad day ahead of you. I hope it goes okay.
Of course.
It's gonna go about as good as it can. He was a good friend.
Oh, my condolences.
Likewise.
All right, you lot stay safe out there, yeah?
And you,
Th-
take care,
you
Hutch.
too.
Good to see you.
Take care of yourself. Keep eye on the wound, you know? Make sure not to get bad. You know what to do if it does.
Yeah, call you guys. You know, I can save my ass again.
Arrivederci. Scusatemi un momento. I need to go get something to eat before I pass out. Doctor not doctor, the doctor again in a long time. Doctor in training, Stefano, yeah. Buongiorno, signore.
I feel awful asking this, but could I borrow $4, please?
So yeah, of course. Here you go.
Thank you very much.
Of course, no problem, signore.
Thank you. When I have the money back, I will give it back instantly, plus edit tax.
Oh, no, no worry about that. No worry. Okay, no problem. Arrivederci, signore. Buongiorno.
Adios, amigo.
I need food before I pass out. Stefano, that's his name. Dude, Stefano's gonna be a wine lover, dude. Whenever Stefano goes drinking, bello bicchiere di vino. The train. Okay, I'm no longer at risk of fainting due to hunger.
That's good. I so appreciate that. How have you been?
It's good. I think I might need to make a little bit of a trip to Taylor. See about tidying up some things.
Oh, okay. Yeah. The one here is not always, it's not too terribly busy sometimes.
The only problem is the road's clay. Gets fucking everywhere.
Oh, yes. Well, you know, we were headed down to Blackwater, so we can all head
Okay.
down to Blackwater and you can try that, Taylor, if you want.
See, maybe we'll do that if we have time where nothing is happening.
Yeah, it's been so far.
This is the tip lines
Okay.
there.
What's happening?
We're going to Valentine.
All right. What's happening in Valentine?
Somebody's calling for medics and law. Let me check next door, see if law is next door. They
All right.
left. Hello? Hello? Oh, hello. They leave you in here? Oh, no, okay. Alright, there's more than one.
No, they don't leave me alone anywhere. You know this.
I think they're maybe down by Telegram office.
Okay, is law aware that they're needed in Valentine? Because
There's
of
a bunch of us that are here, but we're all off duty because a lot of us are heading to a funeral.
Okay, alright. Okay.
But yeah, we've got a tip about what's going on. So
Alright, well, we're gonna head that way.
okay, I
But
would
we'll be careful.
I would send a tip to law to let us know that, or whoever's responding, that you guys are en route too.
Okay.
I can run ahead and do that.
Yeah, yes, and I'll come pick you up. I'm gonna get us a big wagon.
Okay, so I'm just going to Telegram law that we're going to go to Valentine. Scusatemi, sorry. Ciao! Alright. was a while ago.
Okay.
Laser is don't attribute
Ciao.
malice to something that can be equally don't attribute malice to something.
Hop on board.
Whoop.
We got an escort.
Are you coming with us to Valentine?
Me? Correct. Yes, I'm gonna
Okay.
be there with you.
All right. I'll have you take lead, and I'll follow you in.
Understood.
Do. Stefano actually might hunt a lot. Stefano likes hunting.
Riders coming in.
Oh my.
A lot of riders.
Taking a left here. Continuing on the road forward.
All right.
Going down right
Uh,
through the trees.
Uh,
You're
so
taking
the
it right up here.
all right, heard. So the tip that came in said that a gang dropped off. I don't know if it said 5 unconscious, but 5 riders rode in with unconscious people on their horses.
Okay.
Right.
So hopefully, Law will be
Present.
taking care of that. Yes.
Continuing straight.
Heard.
Wagon ahead. Careful.
Heard.
Do.
So depending on how many patients we have, we'll split up.
Continuing straight on the road.
Oh, he's gonna go around. Okay.
Safer for the wagon.
Going down left around here. Just continue on the road. I don't like to take wagons on the track. It does pick up the wheels quite a bit.
Probably better to keep the wagon on the road.
I mean, maybe. Roads
Roads are just guidelines. They're on our own sync.
Yes.
They're just a suggestion.
I've taught him well. So how are you feeling in your training? I know it's been a little bit since you were back.
Going up
You were away for a little bit.
See, I
How
feel
are you feeling?
I've been feel good. I feel like for the last thing that has been kind of keep is just meeting many of the rest of the department. But when it comes to what I need to do work-wise, I think very capable and confident in what I need to do. It's for me a little bit like riding a horse. You don't really just forget how to do it.
Mm-hmm.
It'll come back fairly quick, I say.
Right. Any questions about any of the practices that have changed since you were active last?
I don't think anything new. I see that now. Back before, a long time ago, the go-to for everything was just some cocaine.
Yes, yes.
You know, a little bit of a slap on the ass and get out of here. Here's your cocaine. Good luck. But it's good to see now, you know, more development with the medicine, the aspirin, paracetamol, the fever tea, you know, and it all is very makes sense to me. I think.
Alright, very good, very good. We're likely walking into a multiple down situation, so we'll just, like I said, we'll divide and conquer.
Of course.
Assuming that law has it in a way that's safe for us. It's gonna go the long way around. There we go. Gonna let the deputy go ahead of us, so they can make sure town is safe. We'll just kind of slow up a little bit.
Heard. They care.
I don't think Stefano really has any questions with anything. It makes a lot of sense to him.
That's a train.
That is a train. Yeah.
They're blocking the track.
That's okay. We'll go around.
All right.
There's one thing I can do is navigate around.
Oh, there's a lot
yes.
of people here, huh? Like a lot of people. There's a nice
it-
big old cloud over the over the town.
Yeah, this could be difficult for us to treat patients.
Yeah.
If we get up here and it's difficult, I might have you run down to the telegram office and send a telegram to law asking them, you know,
Clear up a little bit.
clear out town. Might be a need for martial law if there are patients to be treated.
Okay.
Oh, horse. Okay. Let's check.
Oh,
Well,
sorry.
there's the man we come in with. Maybe we can talk with him still, unless he is also fucked.
Hello.
Hello?
Hello.
Hello?
I
Town.
think,
I think we have
Yes,
a little bit of
the-
problem.
yeah.
So I think town might be dusty. So
Okay. I'm going to go down and send the tip for martial law, maybe. Yeah.
okay.
Do 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 do. Able to do so. The train leaving might help.
Almost down to the back of the shins.
Group
I see
of
one sitting here.
Bert is out front. Jug is here. Christine's on the bed.
All right.
Where do you need me?
At the moment, as soon as someone, if anyone, can see or hear you at some point in amongst all the dust,
There's Miss
then
Bella.
I think we should be good.
latch onto a patient because none of these people can see or hear us right now.
I can hear them.
Oh my goodness! Hello.
I didn't hear Miss Trix. Is she
Can you hear me?
just quiet?
Senora Trix is here.
Okay,
Alright, what's
so
happening?
Here she is.
the people around the corner.
Jug
over
sitting
by
on the
Mark.
bench. Yeah. Jug is on the
Jug
bench.
is
I
right
think there's
here,
dust.
Miss Trix, the people that brought them in were talking about wanting to speak with the deputies. Do you feel like you might want Bluestone?
I'm going to need to have people start clearing out of town because
the people who shot them.
people in there, but dust is getting in the windows.
Oh
Is
yeah,
is there anybody injured out here?
The biggest smile ever.
For now, if you could just please leave town, that'd be great.
No
Much
injured?
appreciated.
Okay.
They heard it was like a hostages or something. But
Or if there was law.
if you need Bluestone, I'll change real quick.
I ain't too sure about that, but just for safety concerns, if you could just leave town,
All right, yes, ma'am.
it'd be much appreciated.
She alright?
Stefano.
We're going to only go for about...
Stefano. Apparently, there's another
Hey.
person outside who needs looking at. Another. Was it?
Oh,
Are you Jug?
Fine. I'm fine.
You did really good.
Yeah.
All right.
Are you Jug sitting in front of me?
Yeah.
What was your friend's name?
Greatly appreciated.
Bert.
Bert. Okay.
Bert. Bert.
Yeah, drink sex.
Bart. Is
Well,
there a Bart
there's-
here?
No problem.
Yeah.
You
That's
need
me.
the doctor. You hurt.
Yeah, I need stitching on my right leg. It's wrapped up
Hey,
right
hey.
now pretty good and the bleeding stopped, but I do need it stitched.
Sit down here, por favor.
Yeah, take a seat. I could take care
please
of
sit
wound
down.
while you do take statement. I don't have to speak over.
Yeah.
Okay.
Okay, I think I got everything. Is there anything else you can tell me that would help me out with all of this?
Well, I know one of them's name's John Shaw, one of them's name's Landon Burke, one of them's name is Frank,
Okay, I'll be out front.
and I think there might be a Bill in there. I think Bill, Frank, John Shaw for sure.
Some water or anything.
Landon
All
Burke.
right, I'm going to post up. No, you.
Okay. Thank
There
you.
was 6 of them.
I'm sorry, what?
You looked like you perhaps needed some food or water.
And I'm gonna
Oh,
kill
you
all
know,
of
I
them.
just hadn't drank the water on me.
Okay. All right.
It all started because he came around talking about how Lily owes him money, and then he stuck a gun in Lily's mouth and made a bunch of threats. We don't owe him shit.
Alright, let's get this leg unwrapped and let's take a look here.
All right.
Why would Lily owe him money?
I don't know. He got it in his head that Lily owes him money.
Okay. Okay. Well, that is all from me. I will let you get treated without any interruptions.
All right.
Thank you for your time. I appreciate it.
Yeah, no problem. But like I said, when I find him, I'm gonna blow his fucking head off, and then you can come arrest me, or I'll turn myself in. But either way,
I'll be right back.
Let's get this nice and cleaned up for you.
all right.
Do 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 do. Let's see. Power burns. What the fuck? Right, do you know if you're allergic to cocaine? Cocaine paste?
No, no, I'm not allergic to it.
Okay. Let's lather him up. Yeah, this should help with any immediate pain while I put this all back together into one nice leg, okay?
How's she doing, Bobby?
Yeah, I
Any
feel,
pain?
felt pretty nice.
Okay.
Of course.
The transfusion seemed to
Numbs it real good now, doesn't it?
It does. Holy hell.
I think she'll be okay.
I'm going to start the multiple down for this, all right?
Okay.
Excuse me. What doctors we got in here?
You've got Dr. Bellatrix, Clyde Hutchinson, Josh Rimago, and Trainee.
Clyde Hutchinson. Yeah, there's a fella called Russo. Said he came here to speak to you
Oh,
because
yes,
of
yes.
dust.
No additional
We've asked him to wait outside town, so he's by the telegram station.
All right. I'll see him. I hope he understands that. Just, something happened. That's very
Yeah,
important.
I made him aware that if it ain't an emergency just now, please give the doctor time.
Oh, no, it's something not even medical. So it's he can wait scenario.
Okay.
Sure. All right, thank you.
Thank you.
Thank you.
He went down on your right. He's just straight ahead.
Alright, get this all back together nice and nice, okay? We'll put something on it for the little bit of burn from the
You doing okay?
powder.
Really?
And get you as good as new. Okay.
Alright.
Booze,
I
correct?
appreciate
Your
it,
name?
dog.
You're
Oh, my
doing
name's
good,
Bert.
Really.
Bert.
Like,
You're
really,
Bert.
you know?
Yeah,
What's your last name, Bert?
my real name's Bert Daniels, but everybody just calls me Bert Kurt.
Bert Daniels, otherwise known as Bert Kurt.
Yeah.
Okay.
You hear me?
Yeah, I can hear you,
Get
Bella.
this all
You're
tied
okay.
off.
Okay, I'm trying to get you to.
This will help keep the barns from feeling well like a barn.
Kind of tickles.
Yeah, that's one way to look at it. A little bit of a tickle. A cool little tickle from the heat, huh? This will keep everything all nice close together. Alright, this is all done and dust. Now, what would you say you are in terms of pain levels, huh? Very much pain, very little pain, no pain at all. I'm dying pain.
When I stand on it, if I was gonna put a number between 1 through 10, I'd say it's probably a 7 when I'm standing on it. Sitting down right now is probably about a 4.
Okay, well, obviously, it's probably going to be beneficial for you to, not walk on it if you can so help it. I'll take it as easy as possible. Let me see if I can find something here for you for the pain, yeah?
Okay.
We do still give morphine in extreme circumstances, right? I don't think this is, but...
Yeah.
Okay. I think maybe just Willow Bark will do for this one.
We do give morphine in extreme circumstances, but the hobos have been known to try to fish for morphine and opiates, so...
I thought that may have been the case. It felt like
this is
maybe...
the case for sure.
Yeah, I kind of... Just based off judgment, and I feel like maybe he might be after something like that.
Oh, definitely good judgment there.
Okay. I've got some little tablets here in an envelope for you, okay? for you to take from time
Alright.
to time.
What are they?
Alright, these are little willow bark tablets, okay? You just pop in, have a little bit of water, drink, and it should help out with the pain, okay? Maybe once or twice a day, whenever you start to feel the pain, or even maybe a little bit before, you know. They're safe,
Alright.
you know, you don't have to worry about, you know, getting addicted to them. Be honest, I mean, you don't really want to, I guess you could bite them, but, you know, might not taste the best. You know, willow bark has never been known for its phenomenal taste, right? So,
Yeah.
it's good though. Okay, it will help you out. It'll help you with the pain. Take one probably now. It should kick in a couple of minutes. You know, give it some time, and then be as good as new on your way. Okay?
Okay. Appreciate that.
Of course, no problem. You're all good to go, Bert.
Thank you. Oh, bless.
Alright. Well, make sure you go walk over and speak with Law.
All right. Is the undersheriff Cameron around?
I don't know, but there's definitely a porch full of deputies. So
All right, perfect.
make sure that they are aware and
Well,
that they put a bullet in them or something. Make sure they make somebody aware.
Come on, Bart.
I'm going to get my little bit up here enough for you for the report.
Perfect. I'm just gonna go down through some of these things so we can check them off. I know a lot of these have already been covered, but they're not checked off for you, so I want to make sure we just kind of go through them.
Okay.
Let's see. And I know we already went over because Rana signed off on this. I'm not gonna go over that one. I actually watched you do this. You're familiar with feverfew, willow bark, mint, different things like that, and what they do.
Of course, yes.
Okay.
What they use mint for?
Yeah, people use it for a few things. I use peppermint mixed with either a salve or diluted with a solution, and you put it on somebody's forehead or on the bottoms of their feet, and it helps bring down a fever from the outside.
Okay. I keep that in mind.
Just don't use a straight peppermint extract because it can burn the skin.
Okay.
Oddly enough, it cools you down, but it can actually cause irritation, burn the skin all by
I
itself.
like peppermint mixed with eucalyptus oil.
Oh, that's a good one. Yeah,
Yeah,
mixing it with that is nice.
Also
Eucalyptus
clears
is
the
great
airways
for.
a bit.
That it does. Menthols are good.
Let's see. Standard medications. Okay, so you're familiar with the different ones we have. We're going from most potent down through. First is going to be morphine. That is the most potent. We save that for extreme cases. Yes. We would not give it if somebody's heart rate is really low because morphine will lower the heart rate. And if it's already really low, morphine is not a good choice. Laudanum is in the same family as far as that goes, but it's a little less. Some people who are too sensitive to morphine as far as the itch, I call it, when sometimes they're given laudanum instead.
Laudanum is step down, okay.
I would say it's almost
kind of on
par
par, I
with,
think, right? Yeah.
It's just different. It's different.
Right, yeah.
I myself don't use morphine or laudanum very often unless the patient is in, extreme pain, and I certainly don't want them to be in pain. I'll give it, the more severe the injury, the more chance it's going to be a morphine injection.
Of course.
Grapeseed is an excellent alternative.
Okay. I'm going to go see if I can find Russo very quick. But I already finished my part for the multiple down.
All right.
If you need any more details, you let me know.
All right,
Go
then,
speak.
here's
Go
some
speak to
deputies.
Law. Go speak to Law.
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 Law, Clyde. Law.
Talk to the law.
Ah, they can wait.
Go talk to Laura right now. Watching him like hawk. Okay, he turned left. Good. All right. So grapeseed, I use grapeseed a lot. For moderate to severe injuries, especially for patients who want to avoid morphine and laudanum, it is a great opportunity to use grapeseed. The downsides with grapeseed is if somebody has an active bleed, you don't want to give them grapeseed. You also don't want to give them morphine if they have an active bleed happening at that moment, because both of them will thin blood.
Grapeseed, morphine,
They
thin blood.
also both lower the heart rate a little bit, but morphine is better at it. So if you have somebody with like a heart spell, and they're having really
shoot them up.
They're having I don't know, a heart spell is what I would say, some kind of disease of the heart that's causing it to beat very erratically. If you need to slow it down so it doesn't cause them harm, you can use a small dose of morphine to lower it.
Yep.
But I championed for grapeseed over using morphine or laudanum, just because it has no addictive purposes or properties to it. You're never going to get an itch for it. It does taper off faster than morphine, though. So just
Quicker
something to
drop
keep
off,
in mind.
but less addictive.
Yes, yes. So it's not as long standing for people, but it's also not addictive. And then you get down from that, and you can you're going to be looking at either aspirin in powder or tablets. I don't use aspirin very often. I prefer to use phenacetin, which is really good for minor pains, or willow bark, which is also very natural and good for pain. Most of our patients, unless they have like something, I would say most skin surface level sort of things are going to be willow bark or phenacetin. If you're getting into extensive muscle injuries, arterial damage that's been had to be stitched, broken bones, then you're going to be getting into like grapeseed. And if you get into, I would say, complex fractures or organ damage, depending on the organ, those people are probably going to need morphine just so they don't try to crawl out of their own skin. Any questions about those drugs?
No.
Okay. My apologies if I'm repeating things you already know. I'm just
No
want to
worries.
make sure.
Dot the I's, cross the T's.
Yes, yes.
I finished this up, by the way, so for the report, here you go.
Perfect, perfect. Okay. We also use cocaine paste for numbing skin. It does not help with muscle. It doesn't help with anything except surface level, and we only use it on the skin when we're going to stitch.
Yeah.
Cocaine paste is different than the oral cocaine that we put on in the mouth if we need to numb up an area before we need to do something in there. So they're different. You'll notice they're different because one's in a certain tin and the other's in a different one.
Right.
We have a number of different salves. Some of them, arnica cream is one of the most familiar to people, but we also have healing salves made of marigold or rosemary. We have a eucalyptus one for helping to open airways that you rub on the chest or under the nose.
Yep.
I'm going to do another class on how to make those coming up, I think. But we always have those stocked in the offices. The nurses out of St. Denis love to make them, and then they have them delivered into the offices.
Wonderful.
You can test. We do allergy testing. If you want to give somebody something for, let's say somebody's lost a lot of blood and we want to give them strawberry extract, but we're not sure if they're allergic to strawberries or not, you can draw up the strawberry extract and then do a pinprick I usually choose around the wrist. It's an easy place unless it's where the injury is. Do a pinprick test. If they have an allergy, their skin is going to turn red and they're going to get little bumps, little rash on it. It's not going to be enough to hurt them in any way, but it's much better than injecting them and finding out later when their airway is closing.
Mhm.
Any questions about allergy testing?
No.
Margot, feel free if at any point you want to hop in and, take over or share or add to, I am happy to have you.
All right, will do. You're doing a fine job there, Bella.
Thank you, Margot. You're my moral support, you know?
I'm
losing
here
it a
for you.
little bit.
Just a little bit. All right. Okay. Let's talk about this one because this can get a little bit sticky. So and it's a very sensitive subject, but we have to talk about it.
Okay.
So there is a difference between if a patient stops breathing. We have measures that we can attempt to try to help them breathe. We use bellows to help add air to their. It's like helps them to breathe, and then try to get them to start breathing again. Most of the time, if somebody stops breathing and they're still alive, it's because there is either an obstruction or their lung is collapsed.
Yeah.
Those are the most common reasons. If it's an obstruction, you're gonna have to take care of the obstruction before the airway will reopen, and if it's because the lung collapsed, we're gonna have to take care of that before we can get air reintroduced. There is a difference between somebody not breathing and somebody not having a pulse.
Right.
One of these people is still alive.
Yeah. It's not the one without the pulse.
Yes, once we lose their pulse,
Done for.
check to make sure that that there is indeed no pulse, and then call the time of death.
Of course.
Or you are a doctor, you can sign off on death certificates once you're certified. Make sure. Have you ever done a death certificate before in the crossing?
Probably a long time ago.
Okay. Maybe before you do your first one, we'll walk you through it. Maybe do it with somebody. It makes it easier because there's a few steps that we take just to make sure that everything's covered.
See.
And that's less about me thinking that you can handle it and more about just making sure that
Of
nothing
course.
gets missed.
Of course. I had to grab dinner.
Okay. I still have a
Okay.
few days, maybe hours left in me.
Oh, he's
He's
not
still in
out today.
Sisika. He's still in
Okay, good.
Sisika. He is eligible for parole, though.
Okay, but you made them aware of the concern and issue.
Yes. Oh, no, they're very much well aware. There's a whole file and record and everything.
Okay.
All right. But I do have to go find Russo because he's been waiting for his $1,000.
Oh, okay. Have you in the training have you been present and had to do bellows on anyone?
I think I have done bellows in the past. I know for sure in the past I have dealt with collapsed lungs and lung injuries plenty.
Okay. All right. Okay. So long as you're familiar with it.
See.
If not, it's definitely something the local doctors know how to do. That is the beautiful thing about our local doctors and nurses. If you are here and you're certified and you're all alone, and something is beyond your scope, the local doctors and nurses are at the ready to take over. Or you can always have the patient taken down to Saint Denis, and they can perform whatever is needed there, as far as if it's a surgery that's beyond your scope.
Right.
We don't ever want anyone to feel they need to carry the weight or take it on themselves. If it's something, we definitely don't want anyone to do anything beyond their scope. I know I have sent a fair few patients down to Saint Denis because it just was beyond my scope. All right. Exposure. Do you know how to safely warm a patient?
Safely warm a patient? Yeah, so
If,
usually blankets, hot water bags. You fill the bags, wrap in the blanket, and then wrap them up like a little burrito.
Indeed.
Raising legs, adjusting blood flow where needed.
Very good,
Yeah,
very
the
good.
hot water bags is, I think, the go-to, at least that it used to be for me. That when needed.
All right. So inversely, if somebody has been exposed to the extreme heat, do you know how to cool them down in a safe way?
Oh, I actually don't know if I've ever had to cool somebody down from extreme heat.
Right. Usually, these people are suffering; they already have burns, so you're trying to, treat that as
I
well.
should know
What
this.
you don't want to do, just like you don't want to shock somebody's body by rapidly heating them up. You want to slowly warm them up when they're cold. You want to slowly cool their body down. If you
Cold
cool them
water?
down too quick, like
Bath?
tossing them in a
An
a
ice
bath of
bath?
ice, you could send them into shock.
Of course, yeah.
That's a lot different than if somebody is suffering from a severe fever and you need to rapidly cool them down. That's when an ice bath would be okay.
Right.
But those would be extreme measures when nothing else is work. And I would probably lean into some ice with a cloth before I would toss somebody in an ice
Yeah.
bath. Let's see. And water. If somebody has been exposed to being in the water and they come in, how do you treat that? Maybe they're not drowned. They're not drowned victim, but they're soaked.
They're soaked.
Yeah,
It's
from being in the
definitely
water.
probably get all of the soaked clothes off of them, because that's going to be doing no help, and see about warming them up. They're likely very cold. Checking their temperatures, their breathing. See if there is water in the lungs, if their breathing is bubbling. Tilt to the side, the recovery, and try and get some water out of their lungs. Gravity can be a good friend sometimes.
Indeed, again. All right. Do you have any questions about any of those things that we've talked about?
I don't think so. It is all very, I think, straightforward for me.
All right. How do you evaluate for a concussion?
Usually my go-to is a nice little light. Have them follow the light, check for pupil dilation. Obviously, simple questions, name, date, all of that. But, usually I look for the abnormal pupil dilations.
All right. If you're looking for something a little more serious than a concussion, a possible internal brain injury of some kind, or swelling, do you know how to look for that?
That not be bleeding from the ears.
Could be blood, could be fluid.
Yeah.
Also, you'll notice that their eyes will start to, you wouldn't be able to notice. It's like they are bulging from the socket slightly. That's indicating there's pressure behind the eyes. When there is swelling on the brain or an injury to the brain, it's caused the fluid to be pressed like that. So it's causing pressure. In those instances, they're going to require a shunt. If you're not familiar with or have not done them before, we will be doing a class soon on how to do those.
Drill some skulls.
So that's going to be coming up. So don't worry about it. The local doctors do know how to do that. So if you happen to be here and they need one, you can have the local doctor do that and assist them if you're not familiar with how to do it.
Right. That is the sort of like drilling a little bit to relieve the pressure, right?
So yes. So the process involves drilling a hole. You have to make an incision down to the skin, not near where the injury is. If you, like I said, if you've not done one of these before, I would not recommend
Yeah, of course.
going in blindly. But we'll be having a class on it very soon. Because there's a few in the department that I think haven't been able to experience this as far as learn how to do it. But I feel like this is something that most of us should be able to do. Let's see.
Oh, it's fun seeing doctors and medics with guns. Hell yeah.
All right. Do you know how to? How would you recognize an infection?
Oh,
What are
it's
some of the signs and symptoms of infection?
redness, swelling, pus, foul-smelling discharge, itchiness, general discomfort.
Mm-hmm. Fever is also a good indicator.
That's the one I forgot.
That's okay. That's okay. No, you remembered a lot of them. That's very good. All right. Depending on the infection, depends on how we treat it. Some infections run deep, require more intense treatments. Others can be surface level and be simply, by cleaning and removing any, discharge or drainage, you can alleviate a lot of that. And putting a Medicaid itself. It just all depends on what the cause and presence of the infection, where it's coming from.
Yeah.
But yes, that is exactly how you identify them. Have you treated any infections since you've been back? They don't happen a lot, but they do happen.
Yeah, I think I have a little while ago, but more recently from before. But yeah, I think somebody in Blackwater had a little bit of a minor infection on an injury, and I cleaned it out, gave them some I think the feverfew for the infection. Can't remember, it was a while ago. But I believe the feverfew is good for the infection, isn't it?
So feverfew is really good for the fever that came with it.
Right.
So it probably helped with that to bring the fever down. Cleaning it out really well
Is Clyde
helps
inside
to,
here?
Yes.
Okay, somebody's here to see
helps to
him.
take care of the infection part of it. If it's a deeper infection, sometimes
through.
we have to go in and clean out
Thank you, Margot. Thank
tissue,
you.
You're welcome.
Hello again. Good to see you.
Good to see you too.
things like that.
Say again.
Just all depends
Sorry,
on.
couldn't hear you over her.
That's okay. It'll just depends on where and what's causing the infection. But feverfew is good for the fever, which
Fever.
accompanies it. Yeah.
And then the paracetamol for pain. Or phenacetamol. What was it, Marco, that you had to get? Was it paracetamol, wasn't it, earlier?
Phenacetin.
Phenacetin. What's paracetamol? I know that, don't I? It's something.
That probably is something.
Maybe.
Yeah,
Probably the same
phenacetin
thing in
and,
tablet form or something.
Probably, yeah. Phenacetin and willow barker serve the same purpose for pain.
It is paracetamol for okay.
One's just completely natural, and the other one is put together in a lab.
Oh yeah, paracetamol is another. I think another. I'm looking at my notes here for pain.
It sounds familiar. Some doctors use a few different ones out of Saint Denis, and that's okay as long as we're aware of what it is. It makes it easier because somebody comes in and asks, "Oh, I want the same pill that the last doctor gave me," but then you don't know what that pill is, and that makes it really
Paracetamol
awkward.
is a pain reliever, and a
We
fever
try to
reliever.
avoid that.
Right.
Let's see. Okay. So once you're certified, you're going to have instances where government officials, mainly law and rangers, sometimes it's going to be fellow medics are going to be coming to you for medical clearance to return to work. Most of the time, it's going to be law or rangers. So you're going to want to make sure that their injuries have healed. Sometimes they can be released to light duty as kind of a step up. So it gives them something to do, keep their mind active, while they're finishing up their healing. You'll be able to tell if they're up for it, based on your medical examination. So what we want to check is to make sure that they're not just physically but emotionally ready to go back on duty. I'm not saying we want to corner them and ask them about their feelings, but just kind of gauge as you're having a conversation with them, depending on what their injuries were. If it was straightforward, they were in a shootout and they got shot. Depending on who it is, it may not carry the same emotional toll on them that, say, if they had been abducted and tortured.
Right. Yeah.
So just kind of gauge it based on situation. And of course, evaluate their mobility, their ability to, whatever got injured, did they get shot in the arm and that's their long arm? Are they, experiencing weakness in any of their limbs or,
Right.
things that might need some physical therapy to help them along? Now, I will say, for clearing them for duty, we
Paracetamol in the U.S. was
we really do hope that
1852.
they will follow our instruction. But at the end of the day, they are their own person and they can make their own choices and they have to answer to their superiors, not to us. So we can say we're not going to clear them for duty, and we can, we
1878.
can
Sorry.
let
Armin Northrop
the,
Morse.
their higher up know that we did not clear them for duty if we're worried about their health. But we
their
can't
decision at
tie
the
them
end of
up
the
and
day,
put them
right?
in a
Yeah.
chair, right? It's not like we can make them sit in the corner and do as we say. There's just not a reality we live in, and I don't think anybody wants to live in that reality. Be a lot of pouty people in the corner.
That's it. Paracetamol was used in the UK in
With that being
1956.
said, any questions about the process of clearing somebody for duty?
No, it's very straightforward, I think.
Apologies, this is a lot of me talking at you, but I just kind of want to get these, because I feel like all of this you really have covered already, and I just want to make sure it's taken care of.
So yeah, of course.
And it helps me gauge just really how close to ready. I feel like I think a lot of yours right now is really just reintegration.
Yeah, that's been it for I think a little while now. I just seem to always be finding only really you, Marco, and Hutchinson.
Even then, it's okay. Okay, let's talk about. All right, I know you've administered medications before. If you done a blood draw from anyone yet?
Probably.
It's okay if you haven't. It's not something that is like a mandatory thing before you become
No,
certified. It's
yeah, I
just, I'm
probably have.
checking.
I don't really remember.
It's okay. There'll be plenty of opportunities to do that. We do blood draw clinics and things like that. Right, you know how to use. I have no doubt you know how to use syringes, clear the bubbles, measuring dosages. We go by small, half dose, full dose.
Right.
So a lot of our paperwork, we don't get it down to the
Down to the
increments.
milligram or
Yeah,
milliliter.
that is a lot of math we don't need in our life.
Got it. Appreciate that. Makes things a lot simpler.
I mean, we're so fortunate that these syringes,
Universal size.
yes, and they're gauged. You can tell if it was a small dose you gave, or a half dose, which is half the syringe, or a full dose, which is and of course, depending on what it is, you can tell your dosage. So when we do our paperwork, it's just gauge it that way. Did the patient need a small dose? They got a small dose. Did they need a half dose? Okay.
Yeah. Thank God.
Some things, there's a lot more in practice of what you're doing than with our paperwork.
Mhm.
All right. And you know the use of quercetin?
Yeah, that's for heavy blood loss, isn't it?
Quercetin is to help keep somebody from going into shock.
Okay.
Strawberry
Usually
extract
come
is
across
for
that,
blood
yeah.
loss.
Yeah. Okay.
Mhm.
That and saline
So-
drip for blood loss as well sometimes, yeah.
Indeed.
Quercetin for shock.
So strawberry extract and quercetin go into thigh muscle. You can put strawberry extract into other muscles. We use the thigh muscle for quercetin because it's a good meaty place for it to go, and it bolsters a person quickly. It's not a fix for anything. It's meant to buy time.
Right.
Strawberry extract is meant to help the body start to produce more blood. So it helps kind of bolster it that way. Now, of course, I think this goes without saying. You already know about making sure you clean your hands. Make sure get the tools to the nurses, and they'll clean them for you.
Of course. Keep everything nice, spick and span.
Indeed. All right, we talked about morphine and laudanum. Margot, if you have anything to add at any point, I feel like I am just blabbering so much.
Oh, enjoying it. I just listen.
Oh, okay. Okay, so with morphine, there's a few things about patients we need to evaluate before we give them morphine. One, are they drunk or have they been drinking today? If the answer is yes to either of those questions, we don't want to give them morphine.
Mhm.
If they've experienced extreme blood loss to the point where they're not stable right now, morphine is not a good idea. Head injuries are also another area where if they have like a brain injury happening, morphine is probably not a good idea either. And likewise, if they have a low heart rate, like dangerously low heart rate, not stable heart rate, don't give them morphine or grapeseed.
Got it.
And of course, morphine, we try to avoid becoming a habit for patients. If a patient comes in and they have the wherewithal to ask you for morphine, they probably don't need it. Unless they are screaming and writhing in pain and asking for it, that is a different person.
Right.
So I avoid morphine use when we can because
possible,
we have
yeah.
had people develop an itch for it really quick.
It's addictive. It feels good.
Any questions about any of that?
Not whatsoever, no.
All right, great. We're so close. Look, we're almost to the bottom of my list.
You can do it, Bella.
Wonderful.
You can do it.
Test with kidnapping, Clyde.
Okay.
Clyde? Mm-hmm. The senior medic.
I don't think I can let you do that.
Hold on, they're asking for somebody.
I have no authority, but I'm arresting you.
Okay.
Let me
When
get
do
that
I get
for you.
Clyde? Okay, thanks.
Right now, actually.
Perfect.
Howdy. Is Clyde here?
Mm-hmm.
Should be in the back, I think.
Okay.
Wait, who's asking?
Was that Rooster?
Oh, okay.
Kate crosses.
Oh, it's Kate.
Oh, okay. All right, let's see. Okay, so recently we have dealt with poisoning. If you have dealt
that's
with
fun.
poisoning in your past? Yes, it's
He's
definitely
not
no
in the
fun.
back. I did see him walk off somewhere.
I believe depends on the poisoning, but if ingested, if I recall correctly, charcoal tablets or charcoal was the way to go to try and flush the system out.
Yes, charcoal is a good one if you can get anything down. Especially with certain ingested poisons. With things like nightshade poisoning, which seems to be a flavor of the crossing right now. We have what we call blindside pouches. And in those pouches are a mix of herbs that if you grind them and put them into an IV and get an IV into the patient, because a lot of nightshade poisonings, they can't keep anything down. They'll just vomit it back up.
I believe I saw Kate.
Right.
So we've been putting it through an IV to try to get it there.
Ciao.
Hello.
If he's not in the saloon, I don't know where he'd be.
How y'all
How are
doing?
you? Oh, we're doing
Doing
alright.
alright.
How are you?
Wrong language, but close.
I'm sorry, what'd you say?
The wrong language, but close.
Oh, what language is that?
You said bonjour. I'm not French. I'm Italian. Said ciao.
Oh, ciao. Ciao. No, that's goodbye. Isn't it buongiorno?
Actually, it's both. Buongiorno is good morning, good day.
You know, I had an Italian friend of mine who would have loved to talk to you.
Margot, you okay?
I'm sure.
Yeah, but
Yeah,
He's
he died
staring out the door.
tragically. not so long
I'm
ago.
sorry to hear that.
I'm getting yelled at by the telegram boy. I'm gonna go check down there, and then if you guys still need Bluestone, I can telegram to see if anybody else is around.
Okay.
Okay.
All right.
I'll be right back then.
Thank you.
So yes, charcoal is an excellent choice. Make sure their airway stays clear. If they vomit, make sure they don't.
He
aspirate.
does. He does, Ghost. He does. Fucking cursed.
Certain allergies, even poisonings on the skin. You might notice rashes, things like that.
Right.
Quercetin comes into play with something like this as well because it does combat shock and does help to alleviate some of those symptoms. So if we had somebody come in with a poisoning, we would give them probably quercetin to try to keep their body from going into shock and also to help alleviate some of the reaction that they're experiencing. Or we try to actually treat things like you said with the charcoal to try to cleanse the stomach out. And sometimes, depending on what it is, we might try to either pump the stomach, if you know how. If you've not been trained to do that, I myself have not been trained, but I've been talking to a doctor out of Saint Denis about getting that done because we don't see it very often.
I don't think I've pumped the stomach.
But if it's a recent ingestion and a concern that there is something unabsorbed at this point in the stomach, you could take them to Saint Denis and they would pump the stomach. But charcoal is probably going to be your best bet, and then try to flush it with fluid.
Right. Charcoal and fluid.
Poison from a snake bite, though, that's different. That is very specialty care because some snakes you want to draw out the poison, and some snakes it's more dangerous to try to do that. And some snakes it's not going to do anything trying to do that. Some of them need an anti-venom, and we keep those in Saint Denis. So you're going to want to get the patient there quick. Any questions about, I know we just kind of briefly went over some of the poisonings. We don't see poisonings a lot, but they do crop up sometimes. But you hit the nail on the proverbial head, I would say, by remembering those things you did about the initial treatment of poison.
No, I think I'm good with it.
All right. Okay, so tell me about what have you sutured since you've been back?
Mainly gunshot wounds, cuts, lashes. Mostly, I think it has been mostly superficial. I don't remember. I think I have had some muscle stitching. Back in Blackwater, like that one day where everything was burning down. But since I've been back, mostly I think just superficial gunshot wounds through and through. Nothing too ridiculous to deal with. In the past, I have dealt with, lodged bullets, damaged lungs, well, if I'm being honest, damaged anything. I think the worst one I could list would be the intestine. That was not a fun time.
Yes, that is not a fun time. All right, so with things like the lung, we don't stitch the lung itself, but we stitch the lining over.
Yeah, round, and then most of the lung itself has to do its own healing. But assist it how we can, right?
Yes. So what you're essentially doing is creating a vacuum over the hole.
Yeah.
So that the lung can heal itself, but still be able to expand and contract without ripping.
See.
All right. Cauterization. Did you guys cauterize things when you were here before?
Probably.
Okay, we're going.
It's not a thing anymore. I know it's not great, but that was probably very frequently done.
Yes. So cauterizing is, we try to avoid it because here's the thing: to successfully cauterize something, you have to heat up the wire to a very specific heat. And most people, they just, I don't know what they're doing. They heat up the barrel of a gun and press that on something and hope for the best. But cauterizing causes so much damage, and it also
Yeah.
seals off any damage that's already happening inside. I had a patient almost bleed out on me because, in an effort to try to stop their bleeding, somebody cauterized their wound, but it only cauterized the flesh over the artery, and the artery just continued to bleed underneath. It was a mess. So they almost died. Good intentions, but the outcome was not great.
Of course, it's usually the case when it comes to cauterization.
Mm-hmm. Any questions about stitching? I know I see any questions, but I know there are still things you haven't. Have you ever stitched an artery before?
See, I know in the past I've used sort of like I've had some situations where I've had to kind of use a lining for the artery to like keep it together. It was weird. It was a long time ago. Did some weird shit back in the day.
Okay. All right. So what we do now is we use silk thread. Silk. It's specifically for this. Silk stitching is for the arteries. We don't use anything else on arteries except for silk.
Right.
So, and what we do is you clamp the artery so that they stop bleeding. You have to put two clamps in, one on either side.
Prevent
Once you
blood
get it
loss.
to
Put it
successfully
together.
stop,
Yeah.
and then you stitch it, and then
It was a
release the
sleeve. That's
clamp
what we called
slowly.
it.
Is that all?
We put a little sleeve around it and then like stitched around and then keep it sort of intact.
I wish we had sleeves. That would be nice. So now we use clamps. Get the bleeding to stop. Of
Like we
course,
made a
there are
new tube
certain
with it.
arteries you can't clamp, like ones in the neck. You have to just apply as much pressure as you can to the spot to lessen the bleeding so you can stitch it. Because if you clamp the neck artery, that is a main artery that goes straight to your brain. So that is no good.
That will not go well.
Yeah, so we can't stop the blood flow with that one. Very important artery. So that one become very complicated. You gotta be very careful. We can do tourniquets in extreme situations.
That was but last resort.
Yes, because see, with the tourniquet, now you're getting into a whole different range of problems because it applies so much pressure to the vein. For one, it could cause the vein to rupture going back. It also cuts off all blood supply to that limb from that point forward. So you're kind of putting yourself on a countdown before that appendage is gonna start to have problems that are gonna be, well, either complicating or more permanent, and we don't want that. But obviously, we don't want them to bleed out. So you got to make judgment calls sometimes. You know what I mean?
Yeah, of course.
But I can tell you, in my 2 years in the crossing, and we're probably going to use 10 of them tonight. Now that I say this, but in my time in the crossing, I think I've used 2 tourniquets. Usually, clamps will do it.
See.
All right, let's see. Mark, were you going anything out?
No, I don't think so.
I'm just looking down through the rest of this. Medical tool knowledge. I'm gonna just list off a bunch of these. If any of these sound unfamiliar, stop me and I'll explain.
Okay.
I feel like that'll be the easiest way.
Probably.
All right. Forceps, retractor, scalpel. So retractors, when we make an incision and we want to hold it open, like
Oh, okay, yeah,
so
got it.
the skin wants to close on its own, so
Yeah,
you
yeah,
put retractors in place. It keeps it open.
Got it. Used to using
Scalpel,
hands.
clamps, stethoscopes. You know what a stethoscope is.
Yes, I know the
tweeters,
stethoscope
bones,
is.
bellows kit, drainage kits, and transfusion kits. Have you done a transfusion yet?
Probably.
Probably.
Honestly, Senora Bella, I have done many a thing that it all just kind of blurs into one big hullabaloo of everything, you know?
I believe you. I believe you.
You know, back when I very first came here, I remember there was the board of directors, and there were always jokes about the doctors carrying guns with cocaine bullets and job security.
You know, Dr. Nikolai talked to me about cocaine bullets.
Yeah, yeah, yeah. That was
He asked if that was still a thing. I said no, that is not a thing.
no more no more cocaine bullets. That was a time. There
That
was
was a
an
time.
interesting time.
Let's see. We talked about collapsed lungs. Yeah, because you're a doctor, you have more Chekhov things. This is what you get.
Shit. I have
This is your
cursed
fault.
myself.
Let's see.
Get more
We already
checkoffs,
talked about
but
drowning victims. Wait, what?
I said I get more checkoffs, but they are being checked off.
They are being checked off right now. Because we just talked about all this. Let's see. Do you know how to use a drainage kit to manually drain fluid from lungs?
I've almost certainly used one, but I don't remember how to explain it.
That's okay. With the first thing, so when you listen to the lungs and you hear fluid, the first thing you're gonna attempt is to drain it with a syringe. That's
Right.
the easiest way. Use a syringe to try to draw it out.
Just below the ribs.
Exactly. That's gonna be your point of entry for that. If that does not work, if it fills that syringe, you may want to reassess, see if it sounds like there's a lot of fluid, and then you may need to put a drain in place. This also has a syringe needle at the front of it, so it's not like a giant tube we put in, but it's a syringe with a tubing that goes into you can put it into a pan or something.
Right.
That's if it's more prolonged. If you notice it keeps going, there might be a lung injury that needs to actually be repaired, or it's gonna keep bleeding.
We'll just keep sucking blood out and getting nowhere.
Yes, you'll be able to tell very quickly.
I mean, don't suck their blood out, Stefano.
I'll do my
Yes,
best
no.
not to. I try to avoid doing that. The blood needs to stay inside.
Alright, let's see. You know how to identify different types of fractures?
Like clean fracture, crack, break, clean break,
Yeah, like,
hairline,
mhm.
swelling, levels of bruising. How hurt are you?
How is it? Yes.
How much
body
pain are
feel.
you in? Mobility capabilities.
And then, of course, there are more serious fractures that usually require surgeries.
Scatters,
Yeah.
fragmentation removal, and piecing that shit back together. I remember in the past I used like a kind of a bone paste to kind of help. I don't know if that's still a thing. I don't even remember.
So we do use bone paste, but it's less about restoring integrity to the bone. It's not quite strong enough. It's more for like if a chip
Right.
got
Yeah.
taken out and it's left like a divot that needs to be filled in.
It's a
where bone
filler
paste is
rather
good.
than a glue.
Right. Yeah.
Now, in other situations, depending on the bone and things, and if these aren't things you're familiar with, we do have classes for these because some of these can get very specific. They get into specialty fields.
Calm down for now.
Like for certain bones, like I just completed a series of classes with Dr. Lily about pinning. So now I can do pins and wires for bone for certain.
I think I
types
have
of
done that
fractures.
before. I remember, I think one time in Strawberry, I believe, with Signora Lark.
Oh, I would believe it. Yeah, Lark.
And
I can see.
there was somebody, Signora had a very break arm, and we had to. It was rough. I think she had a big fall, and we pinned, and we put a lot of shit in her to keep that bone together.
Yes, I believe it. I believe it.
I told on some of the other guys too. So
Alright, let's
Maple in
see.
coma? Yeah, a little bit. Just like a
And then
day.
of course, but
Probably be back
if you've
tomorrow.
I'm
If I
sure
see
you've made casts and put them on patients before in your time.
the plastic cast. Yeah.
Alright. Do you know how to handle dislocations? Have you ever put dislocations back in place?
Oh, plenty.
Okay.
1-2 pop.
I feel like that's something you probably did a lot back in the day.
Plenty. 1-2 pops. But alright, count to 3. 1, go.
You want? Yes, exactly. That's the one. Yep. All right. I think I've been there when you've put an IV in.
Yeah, I've done IV for sure.
Have you ever had to deal with here's a new one. Necrotic tissue. Have you had to deal with that?
I think so. And it was very, probably very old method, but maggots was the method.
Okay, yep, definitely no maggots now.
That's how it used to be.
A few things have changed.
Just slightly. I expected that to be the case.
No cocaine bullets and no maggots. We take a
It's
lot
good
of
to have the
effort, so-
modernization, yeah?
Yes. I'm sure the other still works. Everything's still okay, Margot?
Yes, surprisingly, not any fires.
I'm glad everyone has taken a breather so I can go through this list.
I know. So, look. All right. So, do you know how to identify necrotic tissue? Do you remember how to do that?
Doesn't it smell putrid?
Well, even living tissue can smell really bad. It does smell
Fair.
terrible. But the easiest way to
discoloration.
tell is, it turns black.
See.
Once tissue dies, it turns black, and it needs to be removed. Because it will just spread, and become
like a-
gangrenous. It's really bad.
Yeah.
The easiest way to do it
Contaminates.
is with a scalpel, just cutting the
Cut it
tissue
out.
away. Apply salve, and then aftercare, you're going to want to monitor it to see if more of it happens, if any of it got missed. If the infection continues to spread, you might have to redebride it a few times. And then if it gets too deep, then you're looking at skin grafts.
See.
Any questions about that?
No.
All right, we already talked about blunt force trauma to the head, about the eyes bulging and ears fluid. We talked about shunts. Talked about fractures. Okay.
Getting all the checkoffs right now, dude. All the checkoffs.
All right. I'm your mentor, right?
I believe so. You sent me a telegram saying that.
Yes. Okay.
Yes.
That's me. All right. So I feel like all that you're missing at this point, honestly, is just getting you some more hands-on, just so you can actually, apply some practice. Not that you know what I mean, just to get your feet wet again. Unfortunately, it's really quiet.
It's pretty, yeah, difficult because I need people to be
It's-
hurt.
It's scary when it's Valentine's. This quiet. Hello, Flood.
Howdy.
Ciao, signore.
But things can change at the drop of a hat. Not Flood's hat, though.
Speaking of hats.
He's not flood
What?
sad. His hat can never drop. Right, flood? No,
Yeah.
I was saying things can change at the drop of a hat, just not flood
Oh.
sad. His hat can never drop.
Well, I walked in at a dramatic moment, I suppose. All right, we're posted up.
Alright.
Just some hands on, get to work.
Yes.
Simple enough.
You know what? I think let me look through the paperwork and see if we can find some patients who need follow-ups. We can send them some telegrams.
Okay.
It's I'm not gonna lie, it's a little scary that Valentine is this serene.
Well, the one signora did say about a funeral, right?
You think they're behaving because of the funeral?
Maybe we're just not hearing about it because of the funeral.
Oh, maybe. That's probably also possible. I'm gonna think of the first. I'm gonna go with the first one. That everyone, out of solidarity, is behaving themselves for a funeral.
I believe so. Let's err on the side of good this
Like
time.
that
Why not?
reality. Let's live in that one.
Yeah, I agree. I think that's a good one. I just need a moment to focus on my notes here. I'll be right back.
Marco,
Yes, Bella.
when you get a chance, can you talk to Clyde or reach out to Summit? I see a lot of older counseling visits on here, and I feel like counseling visits were supposed to be 3 to 5 visits. And if some of these are really older, maybe checking in with those patients to see if how they're doing.
Okay. I have sent a few telegrams. In fact, I archived one earlier. I'll go through them again now.
Oh, okay. I didn't know.
That's okay. You
I'm
can't
just
read
looking
read
like-
minds, eh?
Like, there's one in here from May, from Mud. Like, does that still need to be here? Or should it be archived? I feel like at this point, it's 2 months ago was the last contact.
I think we should archive them. I found from experience that you normally have a few sessions and then they kind of just disappear, you know? Like maybe
Maybe
they've
don't-
decided they're fixed or something, you know?
Yeah. I mean, maybe leave Cades alone because
Mhm.
Clyde was just going to meet with them. But, you know, I just wonder about some of these other ones. Maybe follow up with these patients, see how they're doing, see if they need anything. Question
All right.
mark? I'm just seeing a lot that are a month to 2 months old, and I don't know if they still need to be here. But I don't want these patients to be lost by the wayside. It's just not my department.
No, of course.
I mean, it's my department, but it's not.
All right.
It's not the part of the department I'm familiar with.
Well,
That's what
I'm
saying.
going to archive.
It's all the same department.
I'm going to archive these two here. I sent a telegram on the 30th of June, and I have not had a response from either of them. So,
Okay, we can always unarchive too. That
indeed.
is always an option.
I'm back with some sausage and rice. Everybody always knows when they are ready, but then they tell nobody.
Mm-hmm. I think that can be put away. That can be put away.
Pork. I almost lost my fork. All right. That was a good time for me to eat well. No time to breathe.
What is this blood alcohol testing thing about?
Where's that?
Huh?
Page 13, DH280.
Blood alcohol.
I think we can archive that. Seems to be a project, and the interested staff were Bianca and AB. Neither of whom are with the department anymore.
Blood testing project. Let me look at it. Oh no, this is it's a dossier. It
That's a
contains
project.
all. Yeah, they've got it on there. It's fine. It has linked files. If you, it's got numbers written down.
Are we looking at the same thing?
Oh,
It says it's a project, blood alcohol testing.
yeah, if you.
Oh, it is a dossier. Yeah, okay.
Mhm. Yeah, we'll leave that alone for right now.
All right.
That's the big blood testing thing. The thing that we do. Oh wait.
No,
Wait,
blood
why is it
alcohol.
called?
Not...
Oh, I was looking at the wrong thing.
All right. Yeah, the one above blood testing.
I appreciate that you agreed with me in solidarity, though.
Well, of course. You know.
He knew you were wrong, but he still said yes anyway.
I appreciate that. Thank you, Marco. It's because I'm getting old. I'm the oldest 20-some-odd-year-old you ever meet.
Oh, you youngsters. All right.
How old are you, Marco?
32.
Oh, you are older than me.
Hmm.
I'm definitely not only 23. I don't know what they're talking about.
You're 23?
No. Maybe.
Oh, okay. Okay, collect samples from various citizens. The very interesting scrolling. I want to hold on to this.
1 second, I'll be back.
I'm gonna remove the interested staff.
All right.
And I'm gonna hold on to this, and
You're going to recycle it, aren't you?
I am. I'm gonna see if we can get somebody interested in taking it over.
All right.
All right. You know me, I don't like to throw things away. They might be
I know.
useful.
I was going to archive it. It's not throwing away, it's just hiding it.
I didn't want to stuff it in a box. Just doing some cleanup here. I think this bump on the head can be archived now.
You think? I think that's the most serious one in there.
Never look away from a
I'm
bump
also
on the head.
correct me if I'm wrong, but if anyone writes their case file as resolved, I can just archive it, right?
As long as it's not today or yesterday, I would give it like. How old is it?
23rd, so I guess that's yesterday.
Resolve is the equivalent of arrest.
Yeah.
No,
Maybe just
Alright.
leave it for a day.
Okay, I'll leave it.
Dude, I really just want to get back into the fucking MedGen Discord.
A few deaths lately.
Mm-hmm.
Hmm.
Russo, you realigned his leg. That's all dealt with, right?
Is that Spink?
Oh no, hang on. It's someone different. I think.
What was their name?
Rossseau.
Rousseau.
Yeah.
I don't think that was me. When is it?
The 17th of July.
Oh, I think I saw that. I don't think that was. That's not me. I don't think that might be Dr. Gray.
It was. It says your name on it. That wasn't Rousseau who we
Oh.
saw earlier. What was it? Just spelt wrong.
Hold on, let me look.
Excuse me.
You and Downey to the surgery.
Oh, yep, that was him. That was actually him.
I can archive that.
Yeah, hold on. Let me fix his name.
All right.
There we go. He wasn't feeling the most chit chatty. Let me just put it that way.
That's understandable.
Okay, probably moved on you now. I have just kind of put it on the top of the pile.
Yeah.
I'll go ahead and.
Top of the pile.
Okay.
Comatose. Coma toes. Haha. Funny.
Oh, jeez.
Hello.
Let's just.
The blind side. Can we archive that?
Shadows.
No one sees.
Hmm.
I got a friend that does that. He always sits on the bench where he used to at the general store here.
Actually,
You can never
David,
see him.
was that
Oh,
there
until
was
he
somebody else who was
appears.
using that
Yeah.
nightshade for something. Actually,
Oh.
leave it for right now because
All
nightshade
right.
is one of those poisons that it's just the flavor of choice right now in the crossing.
All right. Leave it up then.
What's burning? Anything burning? Are we burning?
Oh, did you like the note I gave you, Bella?
Yeah, it was really good actually. Are you gonna put it in the report?
I can do if you think it's good enough to go in there.
Do you think it's good enough to go in there? Say it's not for me.
Oh, maybe. Might be a bit wordy.
A bit wordy.
Oh, is the report I gave you good?
Yeah, that was good. I'm just looking to see.
Does that guy in green remind you of somebody?
Let's see.
No, not really.
This was part of the whole bathhouse thing, right? Who is your patient? I think
Maybe
it's
it's
on
him
your
I'm
note.
thinking
Hold
of.
on.
Seen him around earlier.
Put it in the name. It should be the first
You
line.
did, you did.
Bert, Kurt, Daniel.
I might have to head back to the gun store, JJ. I'm getting a bit tired. I haven't been in roads in
Okay.
a bit. All right.
Alrighty. No worries. Take care.
Yep. Take care, Doc. I'm heading back home to roads.
All right, always
All
good
right.
to see you.
Yeah,
Good to see
signore.
you, Flash.
Yep. Take care.
Excuse me.
Oh, this looks really good.
Stefano's a crossed hands
Perfect.
kind of guy.
Updated.
Maple's crossed arms, Stefano's crossed hands. I hate to get on No Pixel sometime soon. Fuck.
Let me just check.
Do 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 do. Do 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 do. Do, 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 do. I can't look at paperwork. Otherwise, I would. We have some time now. I might go in the around with my clothes a little bit.
Oh, yes, you do have time. We'll come yell to you
Okay.
if we have to go anywhere.
Alright. You will know where to find me.
To the bathhouse.
Alright, let's fuck around with some outfits for Steffi. We have a good bit we can fuck with. Go buy some carrots while I'm here. Carotto, carotto, carrot. Excuse me. Oh, I guess think this person's gonna take. Oh wait, I need to go to the barber as well. Alright, let's see here.
No. wash my hands and face.
There. There we go. All right. Jesus, he could look grizzled. No. I've got all that. He's not the Stefano's not known to be a big guy. He's not known to be a big guy. Well fed, nothing. Clear whistle. Let's see. I kind of fuck with that one. With that one. Look at that one. Dude, please. Do do do.
Is there a line?
See, there's somebody in there that I'm just waiting for.
Do you happen to know who it is? I'm just looking for a
Mm,
friend.
Not a clue.
Oh, okay. All right then. Appreciate it.
No worries. Do 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 do. Do 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 do. They did a good job with the player creation in Red M. It's sure as crap at actual online. Yeah. Yeah, that doesn't surprise me. It's all custom.
I'm Clyde. I'm over here.
Okay, I was looking for the raccoon hat.
Yeah. Finally, dude. All right. This is the OG Stefano. This is when Stefano came to the cross again. All right. Let's see what we can work with here. Well, let's start with the vest. Okay, let's take the coat off. Let's start with the vest, right? 1918 21. Oh, this is the back? Sorry.
Hello?
Ciao.
How long do you think you'll be in there, partner?
Probably a little bit. I just stepped in here.
No! Alright, I'm going to another one then.
Okay. Sorry. Oh, man. Wait. Sorry. $195 is the kind of green, I think. 195, 196. I like 195 a bit more though. Oh, can I make this red? Maybe that's a little too bright. $182. I think you're making Luigi. You just need someone else. What in the jolly Christmas am I looking at? Listen, all right. Let me fuck around a little bit, okay? Let me fuck around a little bit. Wait, I don't need to wear this vest anymore, though. Okay, hold on. Hold on. There was a vest. That one? Or this one? This one? What was the problem? The vest. What was the problem with this one? Why didn't I wear this one? This one? I need a white. What the fuck is white, dude? There, 15 is white. Sorry.
Were you lot waiting to change?
I got the line out there, don't I? Oh, wonderful.
Looking outside. Can't tell. Can't see for shit. Yeah. Tried. Hell no, I ain't alright. Some asshole shot me in my leg.
Jesus.
I don't know. Something about he was frustrated with how small his personality was. Or
I don't
something
like it.
I don't know. I can't remember.
I think they call that penis envy.
All we were doing was hunting, minding our business, and come up with a few of his friends and just start shooting. Oh yeah, I know exactly who it is.
See,
Yeah, when the time's right, yeah, he's gonna lose his head. Of course.
white pants have always been Stefano's thing.
How you been?
But these weren't pants I could find before.
I haven't really done shit. I go and try to help other people do things, and I get shot.
I'm trying to give him that very distinct medic look. You know what I mean? A very distinct medic look. Yeah.
Take care of yourself, Al. See you around. Yeah, good to see you.
Can I change on this? 50, 50, 50. Wait, I can make the brim like red, can I? Well, I can. No. Keep the hat solid. I want this to be solid red. Solid red tie. Bloody. White gloves. Stefano's whole thing is supposed to be that he looks like a walking Italian flag. That was his whole thing. Green, white, and red, my friend. Green, white, and red. But also because the white and red screams medical. White, you wear white as a doctor so that you can see when there's blood on you. I'll make this green. Okay. These shoes I don't like. What? Let's get some suits. Like a proper suit shoes. I make these just all black. Ew, what the fuck? Why are they green? Five? Looks like it's gonna have to be those ones that I was at. Where are they? Where are they? These ones. All right, I think I'm happy with this. Okay. All good, Margot.
Yeah, everything's fine.
It's a me, Stefano.
Everything's still okay.
Yes, nothing's happening.
Seems to be the case. Actually, I need to get something to drink. Forgot to get that for the other way. Oh my god. That much closer to being a doctor instead of a doctor not doctor. Here's Stefano the combat medic. I mean...
Pass it back, eh? Power. Captain, that's
Bank robbery,
Well,
bank
maybe.
robbery, bank robbery, bank robbery.
Well,
Oh my goodness, I
we're
love
medics,
how fast
Stefano.
he
We're not law.
I know, that's why I came back.
Oh, okay.
Yeah, he
Thought
came
you were
in
asking us
here.
to do something about it.
No, I'm just letting you know there's a fucking bank robbery.
I love it. He came running in. Just it's perfect. Good job.
I was just going to get water. I see 4 or 5 people inside of the bank, and I'm like, okay, that's not good. They're all masked up.
I think I saw them all right in, if it's that same group.
Yeah.
Oh,
Maybe you don't go to law or something?
oh, there
Somebody
goes.
should.
Somebody just went on a horse really fast.
I should if there was more bluestone.
Well, we can go back and lock the door.
Yeah, you guys do that.
Oh yeah, we should probably go hide, huh?
Yeah.
I imagine they probably already have a hostage, but
They might not.
if they, yeah,
Is the wagon at the back?
there is not one. No.
Yeah, maybe we could just put a wagon and drive to Blackwater.
Well, we might want to stay here in case we're needed.
Yeah.
I suppose. I suppose that's sensible.
It might. Just maybe.
But since we're locked in here, I don't know if you want to sneak down to the telegram office.
You
Back
talking to
robbery,
JJ
back
or
robbery,
me?
back robbery, back
Oh,
robbery.
JJ. Talk is JJ.
I think it is best that we stay here until it's over.
Do you want to sneak down to the telegram office?
Oh no. I could. Yeah, let me out the back, and then I'll let you know when I am back.
Do the secret knock. You didn't hear.
Nope, I think it's still locked. Was it open the whole time?
Maybe.
I'm just glad I can finally wear my white. It
It looks nice.
I have always wanted to, but I was never able to. And now I am. It's great.
You've always wanted to wear white, and you could.
Yeah, I couldn't find any white suit pants. There's only gray.
Those look nice.
I feel like it screams doctor.
It does, but in all the good ways.
That was the intent.
I love how Margot's just over there waiting for the secret knock.
Guess I'll just eat a carrot.
You hungry? Do you need food?
I'll be fine for a little bit. Probably good until they're done with whatever the fuck they're doing.
Hello, Margot.
I'm back.
Hello. Oh, he's back. Hello.
Man ran like Luigi screaming, Mario!
Thank you.
Welcome.
Was that the secret knock? I'm back?
Yeah.
Well, it's very effective.
It was.
I just saw a group right out towards, was that Grizzlies? Cumberland Forest? Cumberland Forest. I don't know if it was them, though, but there's no horses out front in the road.
Go take a peek.
I could.
There is a lot of law
I
at
do-
the
I hear-
funeral right now, right? So maybe
I hear
maybe
horses
the
now
bank
that are
locked
coming
it
into
down.
town. That would explain why they left quick if it was them.
Don't see anybody inside.
Nope, I don't see any movement.
Who's that? It looks like it's good now. I'm going to actually go get water and food. Ciao.
Nobody inside unless they're in the back.
Let's see, I'll start on combat medics. The combat medics, medical bullets, cocaine bullets. Dude, I'm actually so happy that I can have Stefano in the white now, man. Stefano was always meant to be in all white. And now I can do it. Oh, I just realized I need to get a hotel somewhere. Okay, all good. Grazie, signore.
Mm-hmm.
Whatever that was.
Ciao.
Couldn't hear anything until just now.
Oh, all right. Oh, evening, sir.
Buongiorno, signore. Ciao, signora.
So, anything happening today? At least,
Yeah, dude, that dude over there's risen so hard, man. He's tried so hard to rizz her. I don't know who that is, but man posed up and everything. Stefano's got some heavy potential, if I'm honest. Dude, there's a reason Stefano's my oldest, longest running character. Stefano's a fucking G. that guy is rizzing the fuck out of that woman.
Paperworky.
How do we still have 14 pages?
That's it?
14.
That's it?
Oh, Marco.
What?
Oh, I have 14 pages.
Bella.
Oh, there's Lo. Oh, there she goes.
Oh yeah, he's
She went
trying.
in a rush, I'm not sure.
She's got her rifle out.
Oh, okay.
Oh, there's the rest of the law.
Yep. She's checking it now. Yep, she's done. We got one coming in though.
Oh, okay.
Yeah, we could tell them maybe. Oh, there we go. Time to work.
Have a dislocated leg.
Dislocated leg. Oh, wonderful. I have lots of practice with that. Can I do this?
Yes.
Yeah, of course.
Buongiorno,
Thank you,
signore.
miss.
Are you awake? Can you hear me? Hello?
Can you hear me?
Ciao. Hello. How are we doing today? Probably not so great, huh?
Fell off a cliff.
Fell off a cliff. That is no bueno. It's no good. Very bad, actually. Okay. Well, looks like it may be just this little leg here that has a bit of a problem.
I'm just gonna turn him so you can do your work.
Okay. Have you ever had a dislocated anything before, signore?
Yes.
You have, okay. So then you know what's about to come, see?
Do you have something I can bite on?
Maybe. Do we have something you can bite on?
Yes. I would give him a piece of the willow bark that's in the
Ah,
jar behind you on the shelf.
Okay.
I just bite down on it. It's really tough, so it's kind of thick, so it won't break your teeth. And actually, it mixes with the saliva and helps with pain.
Alright. Just hold on to this for me.
Just gonna turn him slightly for you.
Alright, ready? On three, okay? 1, 2. Three. Wonderful. Look at that. All done. Good as new. It's like nothing ever happened.
I have not seen anybody take a hostage, though a group did ride in and there was a bank
Alright.
attempt.
Let's see if we can maybe get you up and maybe sit you down in the chair, huh?
There's some more coming in.
Up we go. Take it easy. You can lean on me if you need to. Let's get you sitting upright. Come on. Have a nice sit down.
Welcome.
More injured people come. Look at this. It was about time. Alright. How much pain are you in? Signore.
Coming through, got
Mm-hmm.
injured man. I don't know where you'd
Yeah,
like him.
bring him out back.
Okay.
Bring him around to the back.
Okay. There you go, be alright.
It's like bad.
A bad? Is that what you said? Bad?
I think it was clean.
I am very confused. I asked you how much pain you're in, and you said clean.
Just a little, you know.
On a scale of 1 to 10, 10 being I'm dying.
I say 8.
8, huh? 8, 8, 8, 8, 8. Okay, I get you some aspirin for the pain now. Actually, no, it was, what was it called again, Margot? Fentanyl?
Phenacetin?
Phenacetin, that one. Not fentanyl. Alright. Grab these and put them into a little envelope for you. Alright. You want to take a sit down? I can give you a nice little shot of grapeseed extract. That will be a good little temporary holdover, and then I can give you some phenacetin to take home with you, huh? Alright. Let's go straight in here. Just give you a half dose here, okay? I don't think I need to pump you full of the grapeseed, but we'll give you just a little bit, yeah? It should take
Thank you.
pretty quick effect. It'll last you a good bit. It'll help, and then that's when you have the phenacetin, okay?
Okay.
Howdy.
I'm all right in here.
Yes, sir.
See, just a couple of injuries.
All right.
Involuntary cliff jumping.
Oh, wait. What do you mean involuntary?
He fell. He tripped. Oh.
Oh, okay. Damn.
Yeah, my damn horse got spooked by some gunfire, and then it just threw me over a hill.
Oh, that's unfortunate. I'm sorry about it.
Okay. This should be taking effect pretty quickly. You take it easy, okay, though? Because, just try and stay off the leg if you can. Sit down, rest, okay? It won't take too long to get back into good shape, but still take it easy. Can I
Thank
get
you.
your name, per favore, signore?
Tocala.
Chocala?
Tocala.
Okay, can you spell that for me, per favore?
Cokala.
K-A-L-A. Okay. Cokala. Okay. Fantastic. Alright, is there anything else then that I need to take a look at while you're here, signore?
No, I think that was it. I just had a nasty fall.
Fantastic. Okay, well, in that case, you're all good to go. Alright, you take easy. Just keep easy on the leg, okay, signore? Not the Luigi not the Luigi cosplay. You leave my doctor alone. Alright, leave Stefano alone. Scusate, sorry about that.
It's alright.
Alright. Was there anything else you needed from me? Or we all good? All good. Good.
No,
I don't need anything else from you, so.
Thank you for everything.
Yeah, of course, it's no problem, signore. You just take care with the leg, okay? Take easy, per favore.
Thank you.
Okay.
Sir, can I ask you a question?
Sure. What can I help you with? No, I do not. Sorry.
What the fuck? I keep forgetting
No
what it's
problem.
called. Phenacetin.
Anybody else want some cornbread?
I'll take some cornbread if the doctors didn't want any.
Yeah, Doc, do you want some? It's usually $3 a thing of cornbread.
I will not say no to some good homemade cornbread.
Okay.
Is $3 a piece?
Yeah. Would you
Okay, how
like
many?
Oh, I have 2
As-
left.
I have the one. Is good. Okay.
Okay. Thank you so much.
Grazie mille, signora.
Mm-hmm. And I'll go ahead and give you one as well.
Step into the office waiting for the injured.
Yeah, of course.
I'm going to go see what she's doing back there. Make sure I can take help.
Novel, and somebody there was an auction for it, and I believe it was several $100s.
Oh, that's good, right? That's a good price for a book.
All good here. You need any help?
Ah, yes, yes. I'm just checking this now. Looks like it's healing normally. Nothing
It's just
concerning.
my head.
It's your head.
Sits on my neck.
On your neck, yes. Atop your shoulders.
That big old lump.
Here, let me help you up. Here we go. Nice and easy.
All right. Oh, thank you
Might be.
again.
You're quite
Off my
welcome.
face. Well, appreciate the help. Can I give you anything? Some money or an oddly large pear I was selling at the last market?
You're selling an oddly large pear?
I found a tree where the pears are slightly above average in size, so I picked a bunch and would intend to sell them along with my meat, my fish.
I see, I see.
Here, allow me to show you, as I believe we're probably stuck in here, are we not?
No.
Oh, they're all done?
Wait, what is all done? What's happening?
There appeared to be a bank robbery happening.
Oh, again, they happen again, huh? They come back.
That is an oddly large pear.
It is. Feel free, they are delicious.
Can I pay you?
No, of course not.
Is there actual bank robbery again now?
No.
Oh. Ah. Strange. Man said there was.
Let me sit for a moment, actually.
Oh, okay.
That doesn't seem to.
I'm gonna.
What did you do to him?
Huh? He went to sit down for a moment?
Oh, okay. There doesn't seem to be any problems or bank robbery outside. So.
Okay, so but we have to go to Blackwater, is that what I'm hearing?
Yes.
Is it a situation or is it one patient?
I believe one patient.
Okay, Marco, is it urgent? Oh, never mind. Okay.
Yep, much better.
Perfect.
See where my friend went.
Oh, she said she was going to the general store.
Oh, yeah, there you are. Hello.
Right. Thank you.
All right, let's
Right.
all head out.
Welcome.
All right.
We
We're going
need
to
go
Blackwater.
Blackwater.
Okay. All three of you going?
Deserted even.
Alrighty.
The beacon that is Stefano, man. Do.
You can't climb it right here? Ah, all right.
Am I missing
Out of
something?
my eyes.
I could
What's wrong?
try. JJ doesn't see the
Ah,
carriage.
there it is.
Oh,
All right, there we go.
right. Hop up.
Is this an urgent trip?
Well, it's a patient who needs treatment.
Yes.
Okay.
It's bottom a mile away. Is taking a medic hostage a bigger sin than... Both statements said are correct. Usually taking doctors... it's oftentimes doctors are taken hostage.
So am I understanding that situation properly? They came to rob the bank. They left, then they came back to rob the bank?
Did they come back?
I don't think so.
No, I think the
okay.
repairman was confused.
Oh, okay, okay.
I think the repairman was a little confusing.
Understandably so. He did have a head injury.
Oh, Senora Bella, I have a little bit of write-up for the dislocate man. Do you need this for dislocation? Just let it all pop back into place.
No, it's he would likely something like that. I don't think we need to. If it were complicated or he had other injuries.
Sleepy slide. Sleepy slide? Sleepy slide. You guys missed it. I had to take a shot of sriracha sauce earlier. I rolled it on the 10. The 10 bomb, too. What a fool. What a fool. Yeah, thank you, Tarvey. I appreciate that. Dude, look at my fucking coat. Hold on, what if I take the coat off? If I take the coat off. Beacon! I feel like I am a beacon for a medical right now.
You are a beacon.
I might need to
I
put
feel like
my...
my surgical outfit would match that.
That is the thing. I am always in my surgical outfit.
Always ready.
Exactly.
Yeah. How come the medic's uniform colors is red and not white? White's kind of like the, the peace flag and,
Do you know how hard
non-hostiles.
it is to get blood out of white?
Yeah, that's exactly why I wear white, so that I know when I have blood on me.
You'll have a red uniform on by the end of the day.
Yep,
I
probably.
suppose so.
Also, I think some of the reason for the raid, they joke that it has to do with me, but I always wear red, black, and white.
Oh.
But I don't think it's solely because of me.
Maple's hat, Steph's clothes, yep.
But I may have had a push in it.
I don't know, I might
Very
change the
well.
vest to green. It's like red pants
Can
or
I just
something
point
like
out that this wagon is red and black?
Mm-hmm.
that. It is.
I'm so happy.
I thought that was by design. I didn't realize that was not intended.
I think they did it on purpose.
I think
Because our,
maybe white and white and red maybe would be good too.
I think our buggies are red and black too.
Yes, Rain. I was literally thinking of that. I was thinking like the
we
more
did have a vote at one of our.
The more work Stefano does,
department
the
meetings.
redder his clothes
Not
become.
everyone voted. We had a couple of choices.
What were the other choices?
I think one of them was yellow.
Oh, disgusting.
I don't know. I think Elsie wears it very well.
Yeah, but I wouldn't want the whole whack.
Oh no, not for the wagon, for our department colors.
Oh, right.
White and red.
White's just so hard to keep. We'd go through so much of it. You can wear it. I wear white when I do surgeries. Some people love to wear white all the time. You're better than me. I'd have it covered in blood so quick.
I mean, I probably will as well.
I don't
Doc
really.
K used to wear a lot of white. Do you remember Doc K?
Hey.
Or were you in the time of Alice?
I don't even remember Alice. I think it was before then. I
Mm.
mean,
Oh, you were with Spade.
I think so. Spade sounds very familiar.
Spade and Nikolai.
Yeah, that group. Those guys.
Yeah, so there was Nikolai, Spade, and another 2 doctors that Nikolai told me about. And you were probably one of those doctors he listed. And then after you, it was Alice, Dr. Alice, and a few other doctors. And then after Alice, it was Dr. Kavanaugh, which is Doc K, and that's who I learned from.
Alrighty.
Little bit of history.
Was Kay not McKenna? Bianca?
Bianca came after me.
Oh, there's a horse. Let me go get him.
No. Bianca was before you.
No, Bianca
I
was not
think
before me.
Are you sure?
I'm positive.
Hmm.
Bianca became she joined and became a nurse while I was there.
I thought she was around before. There's nobody here.
No, Bianca was an actress for a while.
Maybe
She was an aspiring actress before she was in the medical department.
I remember Lily for sure.
Mhm.
Lily has been around a very long time.
Oh yes. Anything?
Yeah. Oh, disregard.
Oh, okay. Never mind.
Disregard.
Just kidding. Oh, we should probably let Bluestone know about that.
Mm-hmm.
Do.
Interesting. Oh, I guess I thought this was going to be more of a threat to us than it is. It's just a disgruntled person.
Well, who's claiming to be a doctor?
I mean that happens a lot.
Yeah, but we don't want to let them be doing treatment, do we?
No, I'm
Disgruntled. Take a doctor.
Yes. Oh, hold on.
There's Abigail.
Howdy.
Oh, I'm gonna ask her who it is.
Sorry, Dr. Bella. Sorry, doctors.
That's
senora.
okay.
But I'm sort of glad that all happened because, yeah, this fella was irate at the idea that he couldn't practice, and he was like, "Where's the patient?" I said, "Absolutely not. I have no idea who you are."
He didn't give a name.
No, he didn't give a name. It was I was going to send the tip, and
Mhm.
so he, noticed and said something. And I haven't seen him since, unfortunately. But like I gave as much best of a description as I could. It was dark when I saw him, but he was pretty mad. It was silly. It was very silly. But
All right.
if I see him again, I'm gonna try to get a name.
All right. Appreciate you.
Yeah, of course. Y'all having a good day?
So far?
Pretty good. It's been the Q word.
Mm-hmm.
Ooh, well, it's making up for last night then.
You know what? Seeing you reminds me. I need to go buy a paper.
Oh, me too.
When's the new paper? When's the new
I have
issue
one.
come out?
It
I
came out
have one.
yesterday.
Oh, I need to go look.
There's also there was like 9 news stories.
Wow.
Oh, that's
So
amazing.
it's a lot. Yep. Enjoy. It's a nice read. I hope you
Okay.
enjoy the Q word. You're gonna have time to read it.
All right. I'm gonna go get newspapers. Who wants newspapers?
Me, please.
All
I
right,
got
Margot,
them.
you want?
Yeah, might
You-
as well.
All right, I'll be right back. I'm gonna get newspapers and I'll be right back. Newspapers for everyone.
You think you two will be okay here while I pick telegrams? It might be.
I'm
there's no
sure we
guys.
will. Yeah, we'll be fine.
I'll be quick.
Na, 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 na.
Okay. Back with the paper.
All right.
How are you not hot in that coat and vest?
I need to take it off.
Thank you.
Mm-hmm.
Weller also suggests not wearing the belt with the coat and vest.
How are you doing, Jack?
I'm doing well. How is everyone doing?
Top series, what's
Thank you very much.
See you.
And I see you, Jack.
2 riders coming in.
We're here to read the paper.
Oh, really?
Mm-hmm.
Anything interesting? I haven't read it.
Let me see.
Is that Scout?
That Fiverr?
Oh, well, I know whose funeral it was.
Howdy.
Jay, how are you?
Ciao.
Oh, it's not who I thought it was.
No,
Apologies,
sorry.
we're blocking the door for you. There you go.
Yeah, sorry.
Sorry. It was Fiverr.
Damn, I'm too hot.
Oh, Marco, that reminds me something I was gonna do earlier.
Oh,
1 second.
all right.
Thanks.
Mm-hmm.
Howdy.
Howdy. So
Howdy.
he is still in town. I just saw him leaving the telegram station. He
Oh.
has a
All right.
Okay, I am off. to
Okay, you be
make more
safe.
potatoes, which
Stay
is
safe.
what I started doing like 30 minutes ago.
Stay safe. You know what job I absolutely hate on that job board?
What's that?
The deer one.
Hmm.
Gotta hunt and get either perfect or good pelts from them. And you need 10. 10 of them. It took me 4 hours, JJ. 4 hours.
Oh, jeez.
4 hours for 10 pelt?
Yeah. Yeah, 4 hours.
That's
My
a
name's Jack.
lot. Where were you hunting?
Big Valley, the Plains, and tall trees.
4 hours is a long time for 10 pelt.
Yeah, and you know, I consider myself at least a decent hunter. I mean, I did win a contest.
Were you using the hunting wagon? Or
Oh no, I don't. You think I have that much money, sir?
it's only $75 for a rental. If you spent the time for the 20 pelt or the 10 pelt, you should.
Yeah, but I'd rather own my own like hunting cart. But you
Right,
are
well,
right about that.
It might be worth it instead of, making the trip 20 times over. You just put them all 10 pelts into one wagon and then do it in one go.
Yeah, but I don't. You said $75, right?
See, $75 to rent it for 9 hours.
With all them cougars I also killed, that ain't too
Yeah,
bad.
you put those in the wagon too. Stack it all up.
Are you like a recruit medic?
See,
Training?
yes and no.
Oh,
I
okay.
am old doctor from long time ago, so kind of like returning doctor, trainee, doctor, not doctor, but becoming doctor again is what I tell people.
Can you say that again?
Doctor, not doctor, but becoming doctor again.
I love it. I love it. We
That's
need more.
like it's like Eleanor Park. Always on duty, never on duty, Deputy Parker.
Doctor, not doctor. But soon to be doctor.
Jack.
Jack.
Jack, we're in the paper, Jack.
We're in the paper?
We're in the paper, right next to an ad for Bluestone's hiring.
Wait, are you in the paper?
Bluestone as a whole is.
Oh, okay.
See Her No More. It was a story about the seer.
Oh, all right. They didn't put our names in, did they?
No.
Okay.
I gave a statement to Miss Abigail, and I told her I was okay with putting my name in, but I don't know if anybody else was. So.
Right. Well, it makes Bluestone look good.
Oh wait! The land is flowing with milk. Cries of milk. Get your milk here can be heard from wagons moving across the state as enterprising local farmers and ranchers respond to customers foaming at the mouth for that oh so fresh unpasteurized
Has it been busy
stream of
today?
goodness.
Not too bad.
Jimmy Milk!
Howdy. So what'd you do after got done with our little transport?
Oh, what did I do?
Oh, yeah.
Went up to Coulter. We got a bunch of ice. What did we do after that? We made deliveries.
Yeah, that's what I meant after our whole ice
Yeah,
escapade.
I'm trying to remember. Wow. I went up to Coulter. Oh, I was gonna show Roy around, or at least get him at the Coulter and situated.
Like this is.
And then I went to go. I was gonna have a chat with Sheriff Cash, but I had to reschedule, and I went to go talk with a friend about having that chat, and then went back to Coulter with some friends. Made sure they got up there okay, and then went to bed. So really, nothing, not a whole lot.
Very nice.
I am gonna try to have that chat with Cash tonight, though.
Good luck.
Thank you.
I know that man's.
Where's Bobby and Clara?
That's not Bobby.
They just left. They went the other way.
Oh, you're talking. Okay, I meant.
Yeah.
Never mind. But yeah,
Where'd
I
they
know
go?
Cash's sleep schedule, so you'll
Yeah.
be here for a while.
Yeah, 2 hours. He said he wants to meet at midnight.
Oh,
Beat me at midnight.
Deputizing maybe.
Hopefully.
Maybe happening.
Ooh. Bluestone was secretly my cadet training. It was Weller's plan all along.
Like I told you. Howdy.
Howdy.
You know, this would be actually a perfect job for like and also like a medium for the rare. I can't speak now.
Do it, I believe in you.
Railway.
There you go, you got that.
Train thing. Yeah, that.
Yeah, I mean, probably any government job. This would be pretty good, at least recognition, you know?
I don't know about reporting though. We don't really we don't really write anything.
Let me see if our tip line is still everything.
Give me something to do. Give me some work. Give me some work. Give me some work. Give me some work.
Yeah, I didn't do much at all.
You know, I
except
really
hunting.
appreciate Abigail. She is a reporter through and through.
She's good.
Mm-hmm. Indeed. I'm just gonna put this in. Gonna put this in our daily file.
Oh, just to check. Did you check me off on everything now? It's just the reintegration.
I think a lot of it is just just some reintegration. So all the things once we get them all or at least some of them for the most part marked off, then it just comes down to feedback and then it gets to a point and we can put it up for a vote for the rest of the department, and then we go from there. See next steps.
Okay.
But you're on the right track.
I just need to catch other people than you two.
Yes, yes. I think all of it's at this point for you. A lot of it's just reintegrate. A lot of it all along was just reintegration.
Just been
for you, but
reintegration. I just can't seem to catch anybody other than you two.
so
That's
much
the problem I keep running into.
Well, hopefully, the deputy director will be about. Maybe this evening for a little bit.
Oh, is
You
Lily
might be able
supposed to
meet
come
with her.
around?
Yes. Oh, that's right. You know Lily. Yeah.
See, I know Lily very well. Do.
Normally, the night is not this serene.
It would be when I come around, right? You know, I'm the one who needs to get the reintegration in, and now there's nothing for me to reintegrate with.
At least it's a reintegration and not a matter of your, solely dependent on some patients arriving.
That's it. It's the worst, man. Reintegration is so difficult to do.
I apologize. I feel like I've had my face in a clipboard for hours, but this
Oh,
is
no.
life sometime.
I don't see anything to apologize about. It's part of the job, you know.
Indeed, indeed.
Do. I gotta dedicate the time, man. I gotta dedicate the time. I put the time in. Hopefully I can get a vote soon, man. Be nice to hang out with Lily again, if I'm being honest. It would be nice. Yes. It would be nice. It would be nice. Do 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 do. Do 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 do. Maybe 6 hours is too. I mean, 6 hours only puts me at 12 hours, though. Not even.
We've come outside to join you.
Okay.
Yeah, right.
We bring you company.
No problem. Appreciate it.
We're just having that legendary small talk.
Yeah.
The best talk.
Well, hopefully you're better at it than I am because I'm terrible at
well,
small talk.
I'm okay when I get started, I guess. I always think I'm really bad at it, but I always think I'm real quiet, but people always say, no, JJ, you're good. See, and here I am rambling, so I don't know. Jack, help me out.
The weather is mighty kind to us right now.
You said that now, but you don't see that dark cloud coming in from the fucking northwest?
That's why I said now.
And then the other one that's to our south, or not south, but east?
Oh, it's
I
fine.
think the whole sky is just one dark cloud right now.
It never rains in the crossing.
Never, not once.
Never.
It's so dry in the crossing.
Something's telling me you might want it to rain. I don't know.
All right, I'm a big rain person. All right, I like the rain. I know many people don't like it.
Yeah, we really
and I
are.
understand why. It's a lot of water coming down.
That is what happens when it rains. Yeah, there's a lot of water.
So I'm very observant.
Dude, it's too funny.
I hope in the future Weller can change these gloves.
What's wrong with it?
them.
Oh, the gloves?
Yeah, I don't like them.
I
too big.
kind of do.
They're meant to be.
Yeah, if you're shoveling
Are they
horse shit,
Are they rancher gloves or are they cavalry gloves?
they're ranching gloves.
I always thought they were cavalry because they're really
Oh.
thick leather and they go up your forearm a lot like bracers.
Well, yeah, because you don't want horse shit all over your nice arms.
I do like the older gloves though.
Yeah, that's something I never understood. Why do you like? It's not like you're picking up the shit with your hands. Are you?
No.
I hope not.
You're using like a shovel.
That's what a shovel's for, but you gotta be.
Yeah.
So where is the concern of getting shit on your hands come from?
The sprinkle shit. Once you once you shovel the shit, it sprinkles everywhere.
What?
Like overspill from the shovel?
Yeah.
But then it would just be on the ground.
Yeah, that's unless your hands are under the how are you scooping the shit up? What?
No, it's like rain, right? Once water hits the ground, it splatters everywhere, right?
So you need big boots.
Yeah.
But that doesn't explain the glove. I'm not crazy, right?
No, I'm following you.
I don't know. You're crazy to me.
Just don't understand, the point of the big gloves is, you're not going to get shit on your hands. You're not picking it up with your hands, You shovel it. And you throw it wherever you got to throw it.
Yeah, and when you throw it, it like bounces off stuff, right?
What the fuck are you throwing it against? The fan?
Trees gotta grow.
You just sprinkle it around the roots.
I love the topic of small talk.
I just don't understand.
I'm mostly talking about cow and horse shit. I'm not talking about like the goat shit we had in Mexico.
What? Where did goat shit in Mexico come from?
Because I owned and I farmed up in Mexico. We didn't have cattle there.
One injured in Valentine Sheriff's Office.
Worked.
All right, onward ho.
All right.
Oh. Where are we going, sorry?
Valentine.
All aboard.
Excuse me.
Sorry.
Oh, no.
What?
All right, we can go.
Alright, Bluestone, weapons free.
Weapons free.
Weapons free. I've never actually seen the Bluestone stuff, so this is actually a really nice and really neat, like, new little thing. Weller really did Weller really had a great idea with this.
Rider up ahead. Oh, they turned around.
Hmm.
They thought we're coming to rob them.
Possible. A couple guys with guns on the front of a carriage.
They're on the right.
Hello.
Pardon us.
Man, that guy's really quick.
Rider. Crossing the bridge.
Okay.
Slowing down.
Gotta wait for them to pass then.
Thank you.
Howdy.
That was very polite.
Yep.
It's fucking Shaw. Dude, it's Shaw.
Don't got much time to be polite though.
Pretty sure that's a deputy too.
Is this like an emergency?
Always.
Okay, always. Got it.
Wee woo, wee woo, wee woo, wee woo. Code 3s.
Did I hear you say Lily was coming around, Bella?
Maybe. Possibly.
All right. Do we know when?
No. Do you need to
Alright.
speak to her?
I don't know if she needs to speak to me.
Oh. Maybe. Has she not spoke to you yet?
No. But if that's not why she's coming round, then I won't linger.
Oh, I don't know. I'm just assuming she's gonna be around. No specific reason.
All right.
Just me hoping to see Lily.
All right.
Dude, one of the things that I really want to get medical for is that, like, for days where it's still busy and Maple gets hurt early, we can go off early and switch to Stefano and have medical with Stefano. You know, and we can still, like, have a hand in helping things, you know what I mean? And there's also, you know, Jimmy now. And then no pixel on top of that. So I'm now balancing 4 characters. I need to get on no pixel though. We might do no pixel tomorrow. Depends on if I stream tomorrow or not. I'm still in the air.
I have to retreat this patient. I'll check my telegram, see if Lily's written.
All right. Well, I mean, if it's for you to have social time, I'm not going to intrude on that.
There is no intrusion.
It would be nice to see Lily again.
Hmm?
Alright, weapons away.
Weapons away.
Does this wagon have space on the back?
I
don't know.
don't
Maybe.
know.
If it's just one patient, Marco and Stefano, you wanna
There we
go?
go.
Sure, no problem.
All right.
It's a sheriff's office, right?
That's what you said, yeah.
Hello?
Ciao.
Okay, medics, all of you are medics?
Yes.
Okay, so we may
Phoenix in
have an
training.
active situation happening soon. The negotiation, they may be trying to break him out, but I'm not sure yet. He's inside though.
Oh. Do you want me to okay.
Yeah, I'll let
Um,
him in. Should be all right inside there.
Alright. I'm gonna have them go in. You
Disarm myself.
They're going to be treating inside the sheriff's office.
Just this way.
And we may have an active situation happening soon with a potential
Okay.
breakout. But unfortunately, I would
Hold
have
on one
to
second.
let us handle that.
Yep, of course.
Of course. Where
Right,
would you like us to be then?
Oh, the graveyard's a pretty nice spot for you to keep an eye
Just
on.
let me get out here real quick and then you can have all the space you need.
Ciao, signora.
Good day. He's got it's stages they look recent, but I have no idea. They're not taking out, so they popped on his back, and he's got a bullet wound, and I think he's been bleeding quite a bit.
Jesus,
It looks like an animal head. Quite a fun time here.
Scotland medal, so that's by.
Yeah, Marco, I won't be in your way.
No, no way, keep it. Don't worry.
His breathing is not very good, and he's really warm.
Right, he's lost a lot of blood. Marco, can you set up an IV, a sight saline? He's lost a lot of blood. We might need a donor for him.
I'm universal donor.
Well, we could try strawberry extract first and see if that reacts to.
Alright. Let me just test him to see if he's allergic.
I'll be right back.
Alright, no strawberries.
Alright.
Oh no, I can't reach the lock. Are you kidding me?
Might need to call for some help to let you out.
I think I can reach the other one. Oh my goodness. Hey! Whoever, I can't reach the lock of the door from the inside. You locked me there.
It's my bad, my
You
bad.
got locked in.
It's okay.
There you go. You should be able to get out now.
Alright, thank you. I locked this outer door. What is happening?
We're just gonna go down to the.
Okay, this is not in a good spot, Margot.
All right. Well, where is it?
It's really close to the spine. This is a dangerous one.
Has it hit the spine?
It doesn't look like it has, but it's damn near close to it.
Well, if there's no compromisation of the spinal cord, it should be okay.
I'll stay in here with them.
Assume he's unconscious.
Alright.
Everything all right?
All right. All right, do some tests. So, like, just do like a pinprick on his ankle bone or his calf, just to see if the leg reacts. That way we'll be able to tell if there's still feeling and nerves running down there, haven't been compromised by this bullet. But if it hasn't hit the spine, it shouldn't be any problem.
There we go. All right.
Oh my goodness, there's a lot of people injured.
Yeah.
I feel like this is irrelevant because there's 6 people and you got 1 person here.
It
Yeah,
looks like I can see a clear path here to take this out safely.
I heard that it may probably be a
Alright.
completely different gang altogether.
I think that's
He's reacting all well, so.
Okay.
It doesn't seem to have caused any damage. I'll see
Oh, that's
about
good.
safely pulling this out.
He's pretty badly injured, I'm just saying.
Could always fill a syringe with saline and use it to raise the bullet from its position, give you a bit more angle to grasp it if you're worried about
He's been unconscious
forceps coming
since-
into contact with anything.
I don't know if Carmen may have gotten the name.
Okay, alright.
I heard that Hadaway was one of them.
here.
Or we suspect that.
Be very cautious with this.
I'll,
Be
so
careful.
You can maybe climb the.
Kiwi.
No, I'm
Yeah,
okay.
yes.
I can come down. I would appreciate. Sorry, I
If there's not a blood donor here,
I
I
don't have
think
the
one
need
of
to
our
climb
blue
all the
stoners is a blood
time.
donor. Could you ask them to come in?
I'm a donor.
Oh, do you want to be giving blood?
Keep an eye on the backside. Me and Bishop think we just saw that 3 people. Sure.
I'm pretty sure JJ is, but it's up to you.
Well, yeah,
As long as I
you
get some from somebody.
Ask JJ. Marco.
Hmm?
First of all, Bella went to Strawberry to treat a patient.
All right.
But I think she said she'd come back.
Okay.
Secondly, Dad stitched up a wound on his back. Looks quite recent.
All right.
I don't know if you can see in the files if there was anyone that had a similar injury, in case he doesn't wake up, just so we can get a name for him. We don't know who this is.
I think Bluestone might have took off towards Strawberry.
All right. Looks like it's you then, Kiwi.
Yeah, they said they'd be back for you.
Okay.
I didn't see anything. We haven't had many patients tonight, so I guess someone else out there has been doing some doctoring for us.
I see. Okay. Oh, once he's a little bit more stable, I'm gonna see if I can find any sort of identification on him.
Well, we're going to need your blood to get him more stable, I'm afraid.
I know. Yeah. I'll, yeah.
Alright, you look very
Just
All right.
tell me where you need me.
You can sit next to Stefano. He'll set up a blood transfusion.
All right.
Alright, Senor, have you donated the blood before?
Sorry?
Have you donated blood before?
No, I have not.
Okay. So?
Yes, actually, I have.
Okay. Wonderful. Right, can I have your arm, please?
You were negotiating, right? Generally speaking, the negotiator does the paperwork. I believe that the cadet took that statement for you, so you could get that from him. I have a description I can add later. The woman had short red hair. We've got riders coming in. 3? I don't recognize them. 4, 5?
Alright, you're going to have a nice little prick here. I say nice, sparingly.
Thank you for the sparing, Lee. Heads up.
No idea. Yeah, no, like I said,
Let's get this all together. Alright, please let me know if you start feeling dizzy, lightheaded, anything. Sick. You know, we don't want you to get into bad shape, okay?
Yeah, I'd like to hopefully be able to keep on being on duty.
See.
No,
Marco,
take it
can you
easy.
just keep a monitor of his pulse and everything? It seemed weak, and his breathing's been pretty quick. I expect the breathing a lot
course.
from the adrenaline, and, well, the pulse from the blood loss. Ah. I was able to get the bullet out, by the way.
Alright, good. Any muscle damage or anything?
He did have some muscle damage that I already stitched up. I put all of that back together and then tied it up, not tidying up the rest.
Did you give him any medication?
No, not yet. He's unconscious.
Alright.
You're
You didn't give him
probably right.
quercetin or anything like that?
No. I have not given him anything else. Alright. Alright, we'll finish these up now.
Alright, I'll administer a dose of quercetin. Help his body deal with the trauma and the shock of the situation he's been put into. Something with a gunshot wound is always worth doing first, Stefano.
Got you. Kirsten first. Get him.
Of course, we need to see what's going on with this kidnapping.
Looks like a wolf had his way with him for a little bit.
Oh dear.
I haven't checked him for identification yet, Lynn. He had a
Is it
previous
Jack?
wound, but
I think it's
they
William
don't.
Carter.
You know this man?
I think it's William Carter.
I see.
Alright.
I'll see if I can find any sort of identification on him.
Sorry.
Did we get any prints from
Oh,
this bank?
I'm not sure. I was on the pursuit.
Yeah.
It looks like there's a little piece of paper here on him.
Oh, there is.
Is the William Carter here on the inside of the coat?
I see. Did you hear that, Lynn?
Say that again.
There's a little note sewn into his coat. Says William Carter.
Okay. Yeah. Thank you.
How's he looking? Can we stop the transfusion yet, Margot?
We've had that. There's definitely some color returning to his skin. Things are definitely improving. We'll give it another minute, Kiwi.
Alright.
You're feeling good still, right, Kiwi?
Yeah, I'm feeling okay.
Okay. Alright. He's all wrapped up and ready to go, but he doesn't show very many signs of waking up.
Is he gonna be alright, you think?
By the looks of it, yeah, he will be good. He's all closed up, no more leaking. Like Margot said, he seems to be improving condition-wise, but he is not showing any sign of waking up, and it might be a little while until he does wake up.
Alright. Did you hear that, Bolton?
For what, sorry?
He doesn't. He's stable now, I suppose, but he doesn't show any signs of waking up. It's William Carter.
This is William Carter.
Alright, we're just waiting just to confirm his condition here before we stop the transfusion.
Alright. Is he wanted for anything else than this?
No, just this. So I think it'd be ideal if is he in a coma or just gonna be asleep for a while.
It looks like maybe a little bit of a coma.
Okay. I think it might be best for his health then to process him, but keep him here and then move to the ward once he's out.
Alright, I'm gonna stop the transfusion on him now.
Did he open fire, Kiwi? Do you know?
No, I don't think he did. He was just running his companion. That got away, did.
Okay. That. Were you part of this chase, Carmen?
See.
Get this out of you.
Thank you.
You're all good to go. Take your time. Make sure you get something to eat.
Yeah, I'm gonna go get something immediately. Oh no.
We're locked in again, aren't we?
Yes. Please, when there's people inside the cell, or specifically this one, do not lock it from the outside because I can't reach the lock.
There we go.
He's all done and set. I think we're all good, Marco.
Alright. Very good.
He stopped peacefully. He did not shoot at us. The other one did, though. I don't know who the other one was.
So, William Carter stopped?
Like we shut down his horse.
The doors are locked.
And we were telling them to stop running and put their hands up, and he stopped. I don't know.
Yes. Come, pick your up.
Okay.
Look
Thank you both for helping.
Doors also locked.
You're welcome.
Margot, what injuries did this gentleman sustain?
I had a gunshot wound to the lower back, quite near the spine. Some wolf bites to the shoulder and scratches across the upper back.
Yeah, a little
Did
bit
a
older
fresh
wounds.
gunshot wound?
See,
Okay.
fresh gunshot wound, lower spine that the bullet was lodged in, and
Ooh.
old stitches that had to be redone.
Okay.
you
All
alright,
right.
kid?
Thank you.
Yeah, just gave him some blood.
Okay.
Oh, okay. Let me know if you need anything, alright? Like,
General.
Yeah. William Carter.
Well, I've got this Merlot. I'd love a roasted chicken and some carrots.
It's the doctor's office. If you want to take a look
Yeah, can I
inside.
have a
That's
rum
right.
butter and a roasted chicken?
Hey, are
Yeah.
you a doctor?
See, kind of.
Wonderful. I'm looking to buy some bandages or something, some medical gear.
I think the teller here to the right will be able to help you best with that.
Okay. Let's see. What do you
Be
think would be
outside.
good?
I usually like to carry about 5 bandages on me. It seems to help me out if I ever fall off my horse or anything.
Okay, I'll take 5 bandages. Is that gonna be enough for the whole family? I hope we don't get hurt too bad. I mean, the trail can't be that dangerous, can it?
You know what? I can get you some as well. Hang on.
No. You're fine.
Must
You're
damage
fine.
per-
Trust me.
Shut.
We'll be perfectly fine. Should I get a medical bag?
I've
That'll
got you
probably be
2.
good.
So save your money. I got you a couple.
Really?
Just in case. Yeah.
Whoa, you're a kind person.
Cool. I just wish someone would have helped me and my family when I first got here. So.
That's I don't even know what to say. That's awesome.
Well, maybe the old folk tale based off them, you know? A hunter and a lady in red. Quite the pair.
Roof right now. No, there's a man with a wolf head, like a wolf hood, running around. Okay.
Muscle damage. What's this ping?
Ooh, thank you very much. I like your vest as well. I am afraid around, yeah, I would say so. I reside mostly in Blackwater. Blackwater Road, frequently Armadillo. You ever been to Armadillo? Starting to get a little nicer.
Stand by. I'm writing a report right now. You ever had the steak and fries from Del Taco? I've never had Del Taco before. Deep stitch removes are done so muscle damage prevalent and stitched together. No additional term when stitch closed. Alright. Alright. I need to mute this Discord. I just got invited to a Discord that could be pretty neat. You'll see how that comes. I'll leave that. Alright. Only way I could put a poutine with a lot of Latin flavors. It's basically fries, avocado, cheese, and like a ranch sauce. Huh. Interesting. Yeah, William Carter, GSW to lower back near the spine. Old wolf attack injuries, popped stitches, weak pulse, rapid breathing. Patient deemed allergic to strawberries. Saline drip provided to assist with blood loss. Transfusion started between patient and Deputy Keevy. Quercetin provided to patient to prevent shock. Bullet lodged in GSW deemed safe to remove and done so. Muscle damage prevalent. Stitched together. No additional internal damage visible, and wound stitch closed. Old animal wounds cleaned out. Old stitches removed. No additional damage prevalent. Wound stitch shut. Salve applied to both sets of stitches and injuries wrapped. Patient appears to be comatose, displaying no sign of waking soon. Patient left in care of SCSD. Alright, I have the whole report written up here.
Alright.
Would you like for me to give it to you?
I think I covered it, but I'll take it if you want me to. You had a gunshot wound, you removed the bullet, you repaired the muscle, you closed the wound, wolf wound to the shoulder, you flushed and cleaned and sewed that up. Stitches you restitched, right? Wasn't there anything else you did?
No, that's about it. Yeah. Did I put too much detail in this write-up?
No.
Should we notify next of kin about his condition, if there is any on his file?
I don't think there is, I'll double check.
Hell yeah. Sounds pretty good.
Yeah, no next of kin.
And the Bella with the strawberry for another patient, yeah? With Bluestone?
I believe so, yes.
I guess you're just stuck with me then, Mark.
I'm not stuck with you, Stefano.
You're right, I'm stuck with you.
Yes, apparently so. Did McGregor say they were? Was that something completely unrelated or?
It sounded like maybe.
All right, okay.
I'm gonna head out. I'll take care.
You as well.
Oh, man.
Yeah, his charges are less than 90. Is it? I think it's 99 days and below. We hold them locally, right? Something.
Do do. Do do. Do 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 do. Well, now we just big chillin'. Missing medic RP. This could be a fun little avenue to go down. The first person on server you found was Faye. She has a medic at the time. She hasn't played a
Was it a
regular
strawberry,
but
I
a year.
suppose?
Yeah, there you go. Yeah, that was Amber Sage. Amber Sage. I like the white and red medic wagon, dude. DJ, thanks for the hydrate. Appreciate you. Amber was fun. Alright. Doesn't bring her up very much else as Tabitha? Yeah. No, I remember Amber, though. Alright, I need to, look at some things right quick. Do 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 do.
Ah, shit.
I might have got fucked here, man.
There we go. Howdy.
Is the trip okay?
Oh, good.
Good.
Oh, if you could just step outside, I'm just finishing up with this patient. Thank you.
Okay, I didn't get fucked. I didn't get as fucked as I thought I was getting fucked, but I'm looking at flights right now for Vegas for TwitchCon.
Howdy.
Yeah.
Maylin.
Howdy.
She's inside working on the patient.
Okay. Howdy.
Okay.
Howdy.
Welcome back.
I'm all fucking plain. Fuck! Son of a bitch! I'm trying to buy. I'm trying to set my fucking flights, dude. Fucking hell. More fucking planes, I'll tell you that much. Alright.
Any of you need food or water or anything like that?
I'm alright, thank you.
I'm good.
About you, Margaret? You need food or water or anything?
I could take a stew or something if you're going to up this way. If not, don't worry about it.
Yeah, of course.
Thank you, Jack.
Do.
You done here, Bella? Please go to Rhodes.
Moving
Right,
out
let's
now.
go to Rhodes, yes.
Right, sir.
Roads. All right, Margo, here's your stew.
Thank you, Jack. He was here briefly.
Oh, okay.
Thank
Do
you.
do 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 do.
Howdy, Tiki Rava.
Do you want to take the big one?
Yep. Yeah. I was just taking it away. Take it away, nurses. I don't want it anymore.
Oh, hold on.
Mm-hmm.
There we go.
Thank you.
I just stop here really quick. I'm
Yep.
just gonna. Did we send a tip saying we were responding?
I didn't send a tip saying that. I just marked for responding.
All right. Let's go.
Moving. Yep, there we go.
Oh, quickly. Oh, never mind. That's not what I thought it was. But yeah, still quickly.
Mm-hmm.
All right.
I'm a little concerned about the armored wagon.
Oh yeah,
All
we
right,
were too.
weapons out.
We were watching it while it was in town.
Yep. We sent a telegram to Law
Okay.
because one of the people on the wagons had a gun out.
Well, I guess we're going this way now. I think I missed my turn.
I think there's
This is fine
another way you can cut across.
Yeah, there's a right turn up here somewhere.
Yeah, that goes back up to Riggs, right?
Yes.
Oh, people watch out.
Oh,
Excuse
okay.
us, sorry.
Wow, that's great, guys.
Our wagon's better than yours.
Okay.
Horses aren't cooperating.
What the fuck?
You know what's fun about
You can pull
wagons?
on the left rein, actually.
If we decided to beef with these people, we just shoot one lantern.
That's
Oh,
true.
goodness, excuse
Oh,
us.
please
Sorry.
don't.
Apologies, excuse us.
Fucking zip. Fucking
I
zip.
recognize one of those voices.
Whatever that is, that's not us right now.
Yeah, that was Lynn talking to them, wasn't it?
Probably.
No, it was Rusan.
And Rowan, I think her name is.
Impulsive thought, shoot them all. Any wildfires? No, all the wildfires were in fucking Quebec. We just got all the smoke from the wildfires. Wildfires? Wildfires.
Yeah, I think straight, yeah.
Yep, I just wanted to go slow and
Alright.
relatively safe.
I don't know what either of those words mean when it comes to a wagon.
Slow and relatively safe. I am inclined to agree. I don't really know what it means. No such thing.
For patience, yes, wagon. I need to learn it, to be fair. These wagons just aren't built like they used to. Just don't make them like they used to.
Mm-mm.
You just don't make them
Sadness
like they
in your
used to.
voice, Bella. Oh, right, left.
Yep.
I got one outside.
they're
the
okay,
house.
they're okay.
Oh no!
I was far enough to the right.
Oh no!
I don't think I've met Rowan.
What is her accent? Scottish or Irish, maybe? She's a highwayman.
Oh, I see.
She robbed one of my friends and ran with people that robbed me. So I assume that's what they were doing, was setting up for some highway work.
Oh,
Blocking the road.
I see.
Rider ahead. Please go left, fella. Thank you.
You were right, JJ. That was Zip Quill.
I thought so.
Alright, guess what, guys? My flight to Las Vegas for TwitchCon
Margot?
is in.
I'm gonna try to...
Yeah, hopefully
park the
it
carriage
all
where I
works
did
out
last
for you,
time.
Dissa.
Alright.
Best wishes.
Just don't say anything.
Alright.
Rider.
Mm-hmm. Couple riders.
Cool, thanks for the follow, I appreciate it.
Yeah.
Rider ahead.
Yep. Good call us, by the way. Thank you.
Do 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 do. Do 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 do.
Alright, Bluestone, weapons wait.
Yep.
Ton of people. Right next to the sheriff's office.
Oh yeah, I see him now. Eli looks like. Alright, Docs.
Is it doctor's office or sheriff's
Hello.
office?
Hi there, doctor. Looking for injured.
Yes.
Relating to two injured, right?
Mm-hmm.
The two deputies in question. They had relatively minor injuries. In fact, the moment we helped them to their feet, they sprung up and did a couple of cartwheels and then ran away.
So, so wait. So the injured deputies, were they shot?
I think they just had a few grazes.
Oh, okay. All right. So they're feeling the adrenaline right now. Okay.
Yes, I think they're
In
feeling.
about an hour's time or so,
Okay.
we'll have to clean
So,
them up.
They're probably going to be
have
in a
them
lot of
check in
pain.
on us. Yeah, have them check in with us later.
Of course, I'll be sure to remind them quite, not scoldingly, but perhaps like a disappointed parent, maybe.
Yes, yes. Give them the yes, give them the
I'll put my hands on
disappointed
my
pouty
head.
face. Yes, put your
I'll be
hands
like,
on your
all
hips.
right, now let's consider why we shouldn't run away from the good doctors of the state, right?
Just a little more clarity in tipping would be good, I think.
Yes, it
two
was,
officers down makes us think like they're lying on the floor bleeding out, you know?
I apologize. That was my bad. At the time, we were just knew that they were shut down, so that's the only thing that I
Yes.
had.
Okay.
We were getting a grasp of the whole situation ourselves, so.
In which case, I do apologize. I should have been clear.
It's okay.
But
It's all right. It's all right.
Who were they? Just so I know when I see them later.
let's just have a chat out to the side real quick. Doc?
Underchef Windward.
Okay, these are two people they should know better than to just bounce up. I'll be having a word with both of them.
They did bounce up and bounced along their way. They're perfectly fine. It seemed like, but we'll see how the adrenaline wearing off hits them, right?
Mm-hmm.
All right. I just need to tell Bluestone a few things. real quick.
Also, I don't know if you're aware, but when we were leaving Strawberry, there was an armored wagon in the what's that called? Where the lumberyard is?
Lumberyard, yeah. Monto's Rest, I think.
Yeah,
Yes, Monte's Rest.
Yes, I think there was a deputy there. Was it Lynn?
Mm-hmm.
They're talking to them.
I see.
All right. Actually, I think we have something on the tip line about that. Bishop.
We do.
Okay. All right. Okay.
All right. Thank you for that.
All right.
There was one person that was with the person we arrested.
I'm just
gonna
gonna run over
shootout.
and
So
I'm gonna go get
just
some
be
water
on
real
your
quick.
guard.
I'll be
I'm
right
gonna tell
back.
Bluestone just to keep an
Yes,
eye
sir.
out.
Okay. All right. Thank you.
It's quite late. I think I might go to bed.
All right. I
Fizz-
did have a telegram.
Would you ever go check to see if you got word back from Lily?
Well, that's why I'm going. I have a telegram.
This guy.
It also maybe probably have something to eat or drink, whatever that may be.
Okay.
Yeah.
Hi there.
Oh look, you can chop wood here. That's
going on?
convenient.
You can. If you can get a log anywhere around here. Not sure if there are trees to fell.
Give me a second. I'm gonna go check telegram, see if
All right.
if you need to rest. I don't want to keep you up. If it's not there.
Well, I can walk down with you. And then I can head to home. I mean, camp's near roads anyway.
Okay. All right.
I shall also accompany because I can't even read the tip line.
Okay, so
Better if we all
we need
go.
to get you a shovel, Eli.
Yep. In that case, anyway.
All right, just to.
I like the power stance. It's great.
Yeah, I'll come back so you can have your conversation.
Oh, sorry, sir.
Dan, were you there
sorry.
in the forest?
Let me get off my horse. I'm gonna get run over.
Bella, do you need something to eat or drink?
Always. This is just normal for me.
What do you need? Food or drink?
At the moment, water, I think.
Do you have
there
one?
by the lumber camp out by Strawberry, with the 4-horse wagon? Yeah. I mean, you probably know then. They came into Strawberry and did a loop and then left. It was, we believe, Zip and Rowan and some others.
Grazie.
Yeah, I thought I saw Isaac.
Oh, great. Righty. Well, we
Let me know.
yeah, when we rode past, we heard voices and we learned who it might have been.
Okay. When you go to the telegram station next, would you mind sending a tip about that? Because I did not. I did
I
not
did. I
know
did.
that they went into Strawberry. Okay, great.
I did. Yeah.
Appreciate
I didn't
that.
know who it was at the moment.
I just have to check telegrams really quick. I'll be right back.
I'll go with them.
Sorry, I'll be
No,
right
it's
back.
okay.
Clean up crew.
He's not from Lily.
Oh, now we're all sad.
Alright. So at least I know I'm not keeping you up later.
That's fine.
Well.
Well, good to see you both. I'm going to go and lay my head down somewhere.
Alright, you get rest. I see you tomorrow.
Indeed.
Alright.
Have a good rest.
Have
Good
a good
night, Bluestone.
I don't have any telegrams, right?
It's already after midnight. I feel like I should telegram Cash and let him know I'm kind of busy. I will do that.
Okay, he's not around anyway.
Okay.
Hi there.
Howdy, howdy.
Hello, hello.
Pardon us. Oh dear.
Hello.
Eli, this person of interest, is it
Are you ready to go off
somebody
duty then,
crouching
or what
around
are you
wearing
doing?
animal furs and a wolf's head?
Yeah, let me check the tip line, make sure
Not that
nothing
I
is
know
on
of.
fire.
Okay.
Oh, Bella and
I saw something
Lynn!
like that in
Would you care if it
Strawberry,
was?
although I know who it is. They're,
Bella and
I wouldn't if it
Lynn!
is.
Oh, I
What?
wouldn't. Okay.
He's,
You would too. Stop it. You would.
What?
he's from Tall Trees, though. He's
Alright, let's go check
acclimating
the tip
to
line. And then
civilization,
I
I
may
guess.
be stepping off
Gotcha.
duty.
Okay,
Oh
thank you.
my
Huh?
god! Oh my god! Bella and Lynn! I love it.
Come on, take your crate. Come on.
What the heck?
What's going on?
You cannot strap crates to the horse anymore, my friend.
Oh, damn it.
You need a wagon.
I need our.
See?
Well, if there's nothing urgent on that tip line there, you might need to cram cash back.
Well, I just told him that I'm good to talk when it calms down.
All right. Well, like Bella said,
Doo-doo.
she'll be going off duty.
Okay.
I might jump to
If
Jimmy here
there's,
if Bella's
the
going off
constant's
duty.
not on fire and all that. So.
I missed that part. I didn't hear her say that.
If Bella goes
Thank
off duty, there's no medical on duty, I'll go off duty and jump to Jimmy. Jimmy milk! It's been 6.5 hours, so I still have some time on that wagon, I think. Dude. Bella and Lindo. My goodness. Is it burning all down when you go to sleep?
I don't think so. I think it's okay.
Wonderful.
I'm gonna walk down to the telegram station again, but I will return after that.
Okay.
Alright. I'm gonna pop off duty.
Okay.
But they should be around. Well, I'll be around tomorrow. I'm around most nights anyway.
Okay.
See if we can't get you integrated with some other people. Get you some more bedside with patients. See a little more of that, but tonight did not work out for that, which is good for people, but makes it difficult with the application part of all of it.
See.
Sharpen
try-
those skills again.
See, the warm up, get the rest off. But
The warm up, yes.
he will try and be around.
It sounds good. It was nice to work with you again today.
See, it was good.
Oh, geez, it was more quiet than normal.
Yeah, well, sometimes it's better that way. Like, I think
I
still,
miss-
even though it was quiet, we got a lot of stuff checked off, yeah?
Indeed, we did get a lot of things done. Now it's just the practical application of some of it, Give you, honestly, we'd like to get you with some patients. So, like I said, you can get the dust off from all of that. And then get some integration with the rest of the department.
I keep eyes to see if I can try and catch other people around on duty. Aside from you and Margot, because, like I said, that seems to be the only two people I'm able to catch.
I know, right? Yeah, we'll keep at it. We'll get you there.
Eventually, we will.
Mhm.
Hopefully sooner rather than later.
Indeed.
I will probably find my way to sleep for a little bit.
Alright, you have a good rest, and I'll see you next time.
Buonanotte, signora.
Mhm.
Buonanotte, have a good night, you too.
You too, sir.
Yeah, have a good one.
Alright. Jemai milk! Jemai milk.